along with changes that happen in the skeletal muscle itself. Okay. So what happens to the cardiac output during exercise? What happens to the cardiac output? Just a single word in answer. Yes? Increases. Very good. So the cardiac output increases. What happens to the blood pressure? Mean arterial pressure? Okay, so there is a very little increase. And there is what is called as redistribution of blood to various organs. Okay? So let's see them in detail. So this is the detailed picture of what happens to the cardiac output during exercise. So cardiac output increases from 5 liters to 25 liters per minute. So there is a 5-fold increase. It can even go up to 30 liters depending upon the athletic training. Okay? So there is an increase in cardiac output, and there is something called redistribution of this increased blood supply. So which organ receives more blood flow during exercise compared to the resting state? Which organ receives 80 to 85% of the cardiac output during exercise? It is shown in this picture. So 85% of this increased cardiac output goes to the skeletal muscles. Okay? During rest it was 15% of the cardiac output. During exercise it is 85% of cardiac output. So this is called as redistribution. And the blood supply to the GIT and the kidneys are very much reduced during exercise. So sparing blood from the GIT and the kidneys and giving them to the skeletal muscle, this is called redistribution of blood supply. And the heart also receives a bit more of blood during exercise. Okay? So the organs which receive more blood supply during exercise compared to rest are skeletal muscle first, followed by the heart. Okay? Now this increased blood supply is accommodated within the organ, especially the skeletal muscle, because of the dilatation of arterioles. Because of the dilatation of arterioles which were closed previously, now getting opened, through which blood flows. So what do you call this? The previously collapsed capillaries now being opened. Again, capillary recruitment. Okay? And there is a difference between what happens during isometric and isotonic exercise in the blood supply to that particular muscle which is involved in isotonic versus isometric exercises. So in isotonic exercise, the increased blood flow can be accommodated easily, whereas in isometric exercise, because the tension developed is more, whereas the length is not allowed to change, the length remains the same, the muscle, the blood vessels which lie in between the muscle, they get compressed. So they get compressed. So there is loss of oxygen or lack of oxygen, and such things happen during isometric exercise. So the cardiovascular changes put together, there is something called a central command, which in turn communicates with the medulla, the cardiorespiratory area, centers in the medulla, and they withdraw the parasympathetic stimulation and increase the sympathetic stimulation. Okay? So this happens as the first thing during exercise, and they say even before the start of exercise, when a person thinks about doing an exercise, even before he actually moves his limbs for exercise, the just thought of exercise, during that time itself, the central command operates, increasing the sympathetic activity and withdrawing the parasympathetic activity. So this in turn is reflected mainly in the cardiovascular system. So the heart rate is increased by the sympathetic stimulation, okay, How do you call it? Increase in heart rate. Yes, increase in heart rate. What effect it is? Okay, everybody is busy with anatomy or biochemistry, it seems. So it is called as positive chronotropism, and there is inotropism also. Stroke volume also increases. Both of them leading to increased cardiac output, leading on to increased. This will be discussed in detail during the exams. So what happens to the heart rate, stroke volume, cardiac output? Everything increases, but the major change happens with the heart rate. Coming to the skeletal muscle, it is increase in capillary recruitment, as we saw in the previous picture, increased vasodilatation. So there is a decrease in the total peripheral resistance. So this again causes an increase in perfusion pressure, which again causes a mean arterial pressure increase. Okay. So what happens to the blood pressure in detail? So during isotonic exercise, dynamic exercise, the systolic blood pressure increases, whereas the diastolic pressure either remains same or there could be even a fall because of reduction in total peripheral resistance. Whereas with isometric exercises, increases diastolic pressure, but the extent or the degree is less diastolic pressure. And venous return is also increased. People know very well the reasons for that. So the skeletal muscle pump, the respiratory pump, everything increases the venous return. So when the preload increases, the cardiac output increases. So what is the law that lies behind this mechanism? Anybody? When the end diastolic volume increases, the force of so it's called the Frank stalling mechanism. Okay. So putting everything together, it is the brain's exercise center which stimulates the baroreceptors, the medullary centers, and this decreases the parasympathetic and increases the sympathetic output. Changes in the skeletal muscle because of the mechanoreceptor stimulation, and also the chemoreceptor stimulation because of the accumulation of material. So everything together causes increase in decrease in parasympathetic output acting through the medullary cardiovascular centers. So coming to the respiratory system, so what is the major effect of exercise on respiratory system? So this is given clearly here. So the respiratory rate increases from 14 to 15 to up to 60 per minute. And there is an increase in tidal volume from 500 ml to around 2500 ml. And there is increased ventilation and increased in VO2. So when you are engaged in such a kind of training, exercise training, then all the long-term effects are seen in the respiratory system, like increased lung ventilation, capacity, the strength of intercostal muscle increase, and the oxygen diffusion rate increases, everything increases. And you all are very well aware of this concept of oxygen debt and EPOC, post-exercise oxygen consumption. So you start exercise in 0 minutes, the system is not ready to supply that excess oxygen that is needed for the exercise. So initially, though everything comes into play, there is a debt, there is a deficit, which will be compensated afterwards at the end of exercise or after the end of exercise. That is called post-exercise oxygen consumption. So what is not inge vittada anga pidichirudhu. Okay? So that is called EPOC, excess post-exercise oxygen consumption. So in the pulmonary capillaries, the diffusion, the transit time of the oxygen is decreased very much. But this is not a limiting factor because it can get whatever oxygen oxygen is required, it can upload oxygen in a very shorter time. So this happens in the lungs. And as the magnitude of any endurance exercise increases, oxygen consumption also increases in exact proportion until a point is reached. Now at this time it fails to rise despite the further increment in workload, and this is called the maximal oxygen consumption or VO2 max. In normal people, cardiac output is the factor, the major factor that determines the VO2 max. And training in a proper way can increase the VO2 max. So to summarize, so there are metabolic changes, fuel crossover happening as the intensity of exercise increases in the muscle, in the respiratory system. There is a forward central command, increasing the respiratory rate, increasing the tidal volume, Greenwich volume, etc. In the cardiovascular system, it is increased cardiac output via increase in heart rate and stroke volume. And there is a redistribution, vasodilation, tone increases. And in the tissues, in the muscle tissue especially, the extraction capacity it drives. So it is increased. Oxygen extracting capacity is increased. So this is this session. So I'm happy to conclude it at this time. So any queries regarding the contents? If no queries, I will conclude. Thank you.
Thank you very much for your detailed explanation, madam. And I hope that as I already introduced that madam was been well versed in taking some rare topics like that. I remember that I think in 2019, Kanyakumari Medical College, we were in a CB on autonomic nervous system. At that time, I have enjoyed the entire detailed review about that was given by madam. Now he has given an entire detailed review about all these smaller motors, units, larger motor units, everything, and I hope that it will be useful for but as usual some of our students are still in some mood, I think so, but those who are listening, okay, definitely it will be a very useful topic, and thank you very much. And I thank everybody. Thank you.
Thank you so much, ma'am, for this exceptionally brilliant and insightful presentation on exercise physiology, foundations revisited. You have beautifully took us without a strong gas core foundation, concept of precision, impossible, ma'am. We are incredibly grateful for your time, class, ma'am.
Kindly request Professor Dr. Sir and Professor Dr. Anachan sir to felicitate our first speaker, Dr. Jaya Jansi ma'am. I request Professor Dr. Anita ma'am and Associate Professor Dr. Thiruvengadam sir to felicitate the chairperson. I heartily welcome Professor Dr. Ethia ma'am, now HOD, Virudhunagar Medical College. Welcome. And Joint Secretary, Association of Physiologists, Tamil Nadu. I welcome Dr. Venkatesh sir, Associate Professor of General Medicine to the CME. I welcome Professor Dr. Kumar sir, HOD of Pediatrics to the CME. And I welcome Professor Dr. Ram Sundar sir, HOD of ENT to the CME sir. Associate Professor Dr. Shobana ma'am of Pathology to the CME, and also Assistant Professors, Associate Professors, all departments of GTMC. And I welcome Associate Professor Dr. Vidya ma'am of Virudhunagar Medical College for the CME. We'll start with the inauguration ceremony shortly.
சந்துக்குள்ள பெரோடு இல்லை சந்துக்குள்ள கடற்கரை இது இருக்குல்ல பெரோடு இருக்குல்ல பெரோட ரைட் சைடில் மொதல் கட்டிங்கில் கடற்கரை உள்ளுக்குள்ள வயலஸ் ஊர் மக்கள் பட்டா வரும் அப்போ கண்டிப்பாக வரும் வயலஸ் இல்லை 5 மீட்டர் வாங்க இப்போ சொல்லுங்க இல்லை அண்ணே எல்லாம் கிளிக் பண்ணியாச்சு ஒன்றும் பிரச்சனை இல்லை ஒரு ஆஃபனும் இல்லை அதாவது என்ன அவங்க லேப்டாப் நமக்கு என்ன சொன்னாங்க நம்ம டெலிகாஸ்ட் பண்ணுறது வரணும் அது மட்டும் தான் வந்து பேசுகிறது வரணும் இல்லைன்னா அவங்க கொண்டு வரணும் ஆமாம் இப்போ இந்த மெத்தடில் போட சொல்லிட்டாங்க அவங்க இந்த மேலே பேசுகிறது கீழே வரணும் நம்ம பேசுகிறது மேலே வரணும் யார் பேசுகிறது இந்த டெஸ்க்டாப் வந்து மேலே லேப்டாப் வந்து கீழே இந்த வீடியோ எடுக்கிறது கீழே வரணும் கீழே வரும்போதுன்னா ஆடியோ வந்து மிஸ் ஆகுது எதில் வரப்போ மிஸ் ஆகுது ஆடியோ வந்து அவங்க லேப்டாப்பில் வந்து அவங்க ஒருத்தர் நம்ம அவங்களுக்கு பேர் நம்ம எடுக்கணும் அப்படி எடுக்கும்போது நமக்கு சரியாக வந்து இது கிடைக்கும் அப்போ இதை நம்ம மிஸ்டேக் இல்லை அதாவது வந்து நம்ம வந்து லைவ் பண்ண வந்துருக்கோம் லைவ் பண்ண வரும்போதுன்னா இதை பண்ணு கேப்சர் கார்டு மட்டும் கொண்டு வாங்குறாங்க கேப்சர் கார்டு மட்டும் என்ன பண்ண முடியாது இதெல்லாம் சுவிட்சர்னு ஒன்று இருக்குது இது சாரி வாட் மிக்சரில் பக்கம் அப்படியே இதை ஆன் பண்ணிட்டு ஆடியோ கேபிள் எடுத்து உங்களுக்கு கரெக்டான அவங்கலேருந்து மைக்லேருந்து இங்கே கொடுக்குறாங்க அதே விஷயம் இப்போ டேரெக்டாக பேசுகிறப்ப நல்லா கேட்குது இல்லை மேடம் சுத்தம் இந்த கடை தான் இருக்குது ஆஃப் ஆகுங்க இது மேடம் பண்ணிக்கலாம் கவரேஜ் என்ன பண்ண போகிறாங்க இல்லை மேம் அதை பண்ணலாம் மேடம் என்ன பண்ணுறோம் நாங்கள் ஒன் ஸ்டெப் பேக் வேற டேய் டேய் நீங்கள் திருப்பி ஃபார்வர்ட் பண்ணணும் இல்லை அப்படியே அந்த லிங்க் ஓப்பன் பண்ணுவோம் ஓப்பன் பண்ணி லைவ் கொடுத்துருக்காங்க கீழே லைவ்
அதில் கீழே லைவ் சிம்பிள் இருக்கும்.
உங்களுக்கு கொடுத்தல ஆப் கொடுத்துருக்கேன் லிங்க்
இப்போ அதை
So we have a visual treat of Silambatam by a student Abhishek of 23 batch, 22 batch, and it's part of our CME.
இதுதான் நீங்கள் சொன்னது அவங்க சிஸ்டத்தில் வர்றது நம்ம இதில் காட்டணும்.
That was a wonderful performance. Thank you so much.
Gokula Vasak.
கூப்பிட்டு ஓட்டுறது ஸ்லோவாகிடும்.
அந்த இது படிக்கிறது
என்னதான் செய்யணும்.
போயிட்டு அப்படியே இருக்கு.
நெட்ருக்கா நெட்டு வருது. காசு இல்லை
யாருக்கு வேணும்?
உங்கள் வீட்டுக்கு தான்.
என்ன பண்ண?
99947
பெரிய லாரி ஸ்டேஷன்ல இருந்து குமரன் சார்
போய்
அப்பப்போ வீடியோ நிற்கிறது அவன் சிஸ்டத்தில் இருந்து கண்ட்ரோல் இருக்கா? அப்பப்போ வீடியோ நிற்கிது அது வந்து அவன் கண்ட்ரோல் இருக்கா? இப்போ சரி முடிச்சு ஒரு நிமிஷம் என்ன கன்வே பண்ணுறாங்க?
இல்லை அவ்வளோதான், நீ எல்லாம் முடிச்சு ஒரு அரை மணி நேரம் அப்போ பிரச்சனை. அது என்னன்னா ஆடியோ செக்ஷன் வந்து அவன் வந்து நேற்று மாதிரி பண்ணலாம்னா ஒன்றும் பிரச்சனை இல்லை. அவன் வந்து முதல் கேப்சர் கார்டு மட்டும் கொண்டு வாங்க, இந்த பிக்சர்லாம் கொண்டு வாங்க. ஏன்னா ஒன்று இதை மாற்றி இல்லைனா இதை மாற்றி போட முடியும். அவங்க என்னென்னா ரெண்டுமே டிபி மாதிரி வந்துட்டாங்க. அப்போ என்னென்னா ஆடியோ வந்து அவங்க ஆம்பிளிஃபையர் கொடுத்துருக்காங்க. லேப்டாப் வந்து கொடுத்தாங்கன்னா நம்ம கேமரா அவங்க லேப்டாப் வந்து ஆம்பிளிஃபையர் வச்சு கேமரா கொடு அதுலேருந்து போட்டால் இங்கே வர மாட்டாங்க.
அப்போ இதை அவங்கள்ட்ட சொல்லிடுவாங்க.
அதை விஷயம் சொல்லிட்டாங்க.
சரி அதுக்கு என்ன சொல்லுவாங்க?
அதை முன்னாடி கிளியர் பண்ணி நம்ம எல்லாம் ஆல்ரெடி 2 வயர்லெஸ் கொண்டு வந்தோம்.
அப்போ வந்து சொல்லிடுறாங்க கிளியராக.
அவங்க பையன் வந்து என்னென்னா அவருக்கு வந்து லேப்டாப்லேருந்து டேட்டா கொடுக்குறாங்க அந்த ஆம்பிளிஃபையர். இப்போ அவுட்புட் வந்து இங்கே கொடுக்குறாங்க டிஸ்பிளே. அப்போ ஆடியோவும் வீடியோ தனியாக கொடுத்தாங்க. நம்ம எடுக்கணும் ஒன்றா எடுக்கணும். அப்போ இதாக எடுக்கணும்.
அப்போ நம்ம சைடில் அது இல்லை, நாங்கள் கொண்டு வந்து எங்கள் டேரெக்டாக கொடுத்துருந்தா எங்களுக்கு வந்துருன்றது மட்டும் நான் இன்ஃபார்ம் பண்ணலாம்.
இப்போ ஆடியோவாக ஆம்பிளிஃபையர் கொடுத்தாங்க. இல்லைன்னா அங்கே ஒரு ஆடியோ எடுத்து இங்கே கொடுப்பாங்க.
அந்த ஆடியோ வந்து
ஏன்னா கேமரா பற்றி சொன்னாங்க. அந்த கேமரா பற்றி ஆமாம் கேமரா கொண்டு வந்துட்டேன். அதே மேடம் அவர் வந்து டேட்டா ஆம்பு கொடுத்தாரு.
சிஸ்டத்துலேருந்து அதாவது கேமராலேருந்து எங்ககிட்ட வந்தால் தான் எங்கள் கண்ட்ரோல் அவர் சிஸ்டத்துலேருந்து
ஆம்பிளிஃபையர் கொடுத்தாரு.
இப்போ 2 பேருமே கண்ட்ரோல் போகிறப்ப ஒன்றுக்கு தான் கரெக்ட் ஆகுது, ஒன்றுக்கு அன்கனெக்ட் ஆகுது.
இதான் ஒன்றுக்கு எல்லாம்
இப்போ கிளியராக ஆயிடுச்சு. இப்போ இன்னொரு கேபிள் வாங்கிட்டு வர்றாங்க.
இல்லை மேடம் இருந்தாலும் போட்ட மாதிரி இருந்தால் ஒன்றும் பிரச்சனை இல்லை. கிளியராக
அன்றைக்கி அங்கே சிஸ்டம் நம்ம வச்சுருந்தேன். அது நமக்கு நைட்டு 10 o'clock மேலே தான்
இன்றைக்கி டிபி வீடியோ நம்ம பண்ணோம் அப்படின்ட்டு இதோட ஆடியோ வரணும் அதோட ஆடியோ வரும்போது
ஒரே டைத்தில் 2 சைடு ஆடியோ வரப்போ நம்ம இன்புட் வந்து வெளியே வர இப்போ கிளியர் ஆகிடுச்சு. ஒருத்தர் பேர் முத்து, இன்னொருத்தர் பேர்
மனம்.
கேமரா எடுக்கிறவர் வீடியோ எடுக்கிறவர் தான் மனோவா?
Dean ma'am is be starting the inauguration ceremony short.
அந்த பையன் இன்னும் போகல. அப்போ அதை வந்ததுக்கப்புறம் தான் சவுண்ட் வெளியே
சவுண்டில் வந்துச்சு கொஞ்சம் லைட்டாக பிரேக் ஆகுது. அதே கிளியர் பண்ணுவோம். அதுக்கான என்னன்னா கேபிள் போடுவான் போட்டு மாற்றி மாற்றி பார்த்து உள்ள வாய் பார்த்துக்கணும் ஃபுல்லாக ஆட்டே விடும் ஒன்று
நம்ம வாங்கிட்டு மிஸ்டேக் சொல்லி சொல்லி வைப்பான் போட்டு.
லைட் அடிச்சு அதை மட்டும் கேபிள் பண்ண மாட்டேன். சின்ன கேபிள் பேசுறீங்களா? ஹலோ ஹலோ கேட்குதா? போயிட்டாங்களா? ஃபோன் பண்ணுங்க, நான் பண்ணுறேன். போயிட்டாங்க. உங்களுக்கு பிஎஸ்ங்களா? பிஎஸ்ங்களா?
என்னோட
எனக்கு வர மாட்டேங்குது பேக்கெல்லாம். நெட்டு போச்சு. அவனுக்கு என்ன சொன்னாங்க, கேப்சர் கார்டு மட்டும் கொண்டு சொன்னாங்க. கேப்சர் கார்டுக்கு சம்மந்தமே இல்லை சொன்னாங்க.
இந்த மாதிரி 2 தான் ஓட்டு.
கேப்சர் கார்டு மட்டும் கொண்டு வந்தீங்க.
நீங்கள் செட்டு அதை எடுத்துகிட்டு வரப்போ இப்போ
இந்த வயர்லெஸ்ஸு இது எல்லாம் கொண்டு வந்து இப்போ
இந்த வயர் மிதிக்குது இல்லைங்களா?
Good morning. Every inauguration marks the beginning of a new journey filled with opportunities, learning and achievements. Today's event is a testament to our commitment to scientific knowledge and promoting health through evidence-based practice.
I request all the dignitaries to occupy the seats on the dais.
I request Dean Ma'am, VP Ma'am, MS Sir, RMO Sir,
President APT Dr.
Tia Ma'am, RMO Sir, Dr. Sivakumaran Sir, ARMO Ma'am, Dr. Manimali Ma'am, to occupy the seats on the dais. And Professor Dr. Anita Ma'am.
அகரம் முதல் உலகம் வரை அறிவின் ஒளிவை பரப்பிய தமிழ் மொழிக்கு மரியாதை செலுத்தும் விதமாக நமது நிகழ்ச்சி தமிழ் தாய் வாழ்த்துடன் தொடங்குவோம். அனைவரும் எழுந்து நிற்குமாறு அன்புடன் கேட்டுக்கொள்கிறோம்.
நீராறும் கடலொடுத்த நிலமடந்த கெளிலொழுகும் சீராரும் வதனமென திகழ் பரத கண்டமிதில் தெக்கணமும் அதிசிறந்த திராவிடனல் திருநாடும் தக்க சிறு பிறை நுதலும் தனித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிலமை திறம் வியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Let's move on to the lamp lighting ceremony, a tradition that symbolizes the dispelling of darkness, symbolizes the triumph of knowledge and enlightenment. I respectfully invite our Dean Ma'am, MS Sir, President APT, Professor and HOD of Physiology, RMO Sir, to light the lamp.
பிறக்கும் இடத்தில் அறிவு மலர்கிறது. அறிவு மலர் அந்த வெற்றி முதல் அடிய குத்து விளக்கிய கல்லூரி முதல்வர் அவர்கள்
போதினிலே இன்பத்தேன் வந்த பாயுது காதினிலே செந்தமிழ்நாடென்னும் போதினிலே இன்பத்தேன் வந்த பாயுது காதினிலே எங்கள் தந்தையர் நாடென்ற பேச்சினிலே ஒரு சக்தி பிறக்கத மூச்சினிலே செந்தமிழ்நாடென்னும் போதினிலே இன்பத்தேன் வந்த பாயுது காதினிலே ஆறு தமிழ் கண்டதோர் வைகை பொருளை நதி என மேவிய யார பலவோட திருமேனி செழித்த தமிழ்நாடு கல்வி சிறந்த தமிழ்நாடு புகழ் கம்பன் பிறந்த தமிழ்நாடு கல்வி சிறந்த தமிழ்நாடு புகழ் கம்பன் பிறந்த தமிழ்நாடு நல்ல பள்ளிதமாயின சாத்திரத்தின் மனம் பாரு.
Thank you, everyone. It's my privilege to welcome a dynamic personality, Professor and HOD of Physiology, Government THENI Medical College, Professor Dr. Anita Mohan Ma'am, whose leadership, vision and constant guidance have been instrumental in organizing this program. I kindly invite you to deliver the welcome address, ma'am.
Respected Dean Madam, our esteemed Chief Guest Madam, beloved Vice Principal Madam, who's on the way, respected Medical Superintendent Sir, respected RMO Sir, ARMO Madam, respected heads of various departments, learned faculty members, invited guest speakers, distinguished delegates, and my dear students, a very warm and pleasant morning to each one of you. On behalf of the Department of Physiology of Government THENI Medical College, it is my absolute honor and privilege to welcome you all to this continuing education program titled Kalari 2026, a physiological arena for precision exercise prescription. The theme of the CAP is exercise physiology and its clinical applications. As physiologists and medical practitioners, we are aware of the profound impact of physical activity on the human body. However, for decades, exercise was merely viewed as a lifestyle choice or a general recommendation. Today, medical science is witnessing a monumental paradigm shift, and global frameworks like the American College of Sports Medicine have emphasized that exercise is no longer just a recommendation, but it is a powerful evidence-based therapeutic and preventive drug. Like any potent drug, exercise requires a precise dose, a specific frequency, and a careful consideration of indications and contraindications. This is where the gap lies. While the basic science of cardiorespiratory, muscular, and metabolic responses to exercise is very clear to us, translating that foundational knowledge into a safe, individualized clinical prescription remains a challenge for many of us. This CME was envisioned precisely to bridge that gap, to take physiology out of the textbooks and bring it directly to the patient's bedside and the clinician's prescription pad. Over the course of today's sessions, we aim to equip you with core knowledge about the fundamentals of exercise physiology, with unpacking the FIT principle and understanding the dose-response relationship of physical stress. You will be learning how to interpret critical parameters like VO2 max, heart rate kinetics, metabolic equivalence, and also to master risk stratification. And finally, we'll empower you to confidently design tailored exercise prescriptions, not just for healthy individuals and the elderly, but safely customizing it for patients with cardiovascular disorders, respiratory diseases, and orthopedic conditions. For those who are curious to know the reason behind the title Kalari, there is an interesting note behind that. And the word Kalari denotes, as all of us know, that it is the Kalari Payattu, which is a martial art form of Kerala, which is our neighboring state. And we in THENI district, we share our borders with that state. So we thought that it would be apt to have Kalari as the name for this exercise physiology CME, because Kalari is a exercise form or a martial art form, where the whole body is involved in doing precise precision exercise is given to the learners. With that interesting note, I extend a warm welcome to our respected Dean Madam to this CME. Under the dynamic leadership of our Dean Madam, our college and hospital has scaled new heights, and Madam is the main driving force behind all the academic activities of this institution. Thank you, ma'am, for gracing this CEP by your presence. I welcome our beloved beloved Chief Guest Dr. Renetia Madam, Joint Secretary of APT to our CEP. Madam has been closely associated with all of us in the Department of Physiology in THENI. Ever since our post-graduation days, she has been and continues to be a mentor for all of us, and we all share a special relationship with Madam. We are immensely happy for your presence here, Madam. We are conducting the CEP program under the banner of Association of Physiologists of Tamil Nadu, and the President of APT, Dr. Muthusalli Madam, who was scheduled to be here, is not able to attend this program and has sent her wishes for the successful conduct of the program. Thank you, Madam, for your wishes. I extend a warm welcome to our beloved Vice Principal, Ma'am, to the program. Madam is very supportive and encouraging for all the academic activities held in our college, and she is a pillar of support for all our endeavors. I extend a warm welcome to our Medical Superintendent, Sir, and RMO, Sir, ARMO, Madam, for the CEP for her gracious presence. We are incredibly fortunate to have a distinguished panel of guest speakers who are experts in the domain of exercise physiology. I welcome Dr. Jaya Jansi Madam, Professor and Head, Department of Physiology, Thoothukudi Medical College, and Dr. Sendil Kumar, Associate Professor of Physiology and Exercise Physiologist from AIMS, Madurai. I extend a heartfelt gratitude to them for gracing the program with their presence and sharing their valuable expertise. I welcome our esteemed faculty member of Medical Education Unit, Dr. Shankareshwari Madam, who is going to conduct a session on micro teaching skills and followed by a contest. I extend a warm welcome to all our delegates, both online and offline. Your enthusiastic participation from various institutions shows the growing recognition of lifestyle and exercise medicine in our modern healthcare curriculum. We fully trust that today's sessions and discussions will enrich your clinical acumen. Last but not the least, I welcome our beloved Phase 1 MBBS students who have participated enthusiastically in the concept mapping competition and displayed their subject knowledge with utmost creativity and created mind-blowing concept maps which we have exhibited in the hall. I also welcome the council batch students who are doing a wonderful job in organization of this CME. I welcome you all once again to what promises to be a highly stimulating and intellectually rewarding day. Let us collaborate today to ensure that we can confidently prescribe movement as a medicine for a healthier tomorrow. Thank you very much. Enjoy this moment.
Thank you, ma'am. Now, I am greatly honored to invite an exemplary leader and a compassionate administrator, a dedicated academician, who has been a constant source of inspiration, guidance and encouragement to both the faculty and students of Government THENI Medical College, none other than our Honorable Dean Ma'am, Professor Dr. Muthu Chitra Ma'am, to deliver her inaugural address.
Good morning to one and all present here, respected dignitaries on the stage and off the stage. My wishes to one and all. First and foremost, I congratulate the Department of Physiology to have taken up this topic for their CME. So I am part of ENT, as you know. So we had a sleep lab at ENT. Our physiologist from KMC, they came and asked me, Madam, why not you attach it to our department? Physiology is the one department who is qualified to run sleep lab. So now they are entering into the clinical arena. So they want to do and contribute something to patient care. That has to be appreciated. And this definitely is part of physiology only, because the changes nowadays, as Madam has rightly pointed out, there is a paradigm shift about the exercise. I don't know whether I have to state it as a mania. Sometimes we see some people go, they drop dead in the gym. So all these are because they don't have a basic idea about the physiological changes that occur during any exercise. So any person who is qualified to advise regarding that should be a physiologist. So they have rightly taken up, and the name was actually aptly selected. Kalari is one great martial art. It is a form of exercise too. It is not only a martial art, it's a form of exercise too. So your CME has been rightly named. So each and every part of CME has been crafted by the department. So they have involved wholesomely into this CME, I can see that. And I'm really happy that the basic departments are also bringing in CMEs and they are incorporating clinical subjects into that. So I wish all our PGs from the clinical departments were also present here to assimilate knowledge regarding this, because we also suggest exercises from various departments like a diabetologist, cardiologist, physician, all of us suggest exercise. And our PGs, they should know the basics about what is going on with the exercises. So I think this been brought to their doorstep with the eminent speakers from various medical colleges. Unfortunately, I don't see that much of an attendance. In future, I request you all, I know that a large crowd online, but why not our students from THENI Medical College avail this opportunity? So the next time I would like to see the hall full. And wishing Physiology a grand success in the CME and for their forthcoming events. Thank you one and all.
Thank you, ma'am, for that wonderful words. I feel immense pleasure and privilege to welcome an energetic professor, an enthusiastic teacher, a dedicated academician, Joint Secretary, Association of Physiologists, Tamil Nadu, our former HOD, now Professor and HOD, Department of Physiology, Virudhunagar Medical College, Professor Dr. Ethia ma'am, to deliver her presidential address.
Very good morning to all of you. Respected Dean ma'am, dignitaries on the dais and off the dais, and my students. This THENI Medical College is not new to me. I am very closely associated with this medical college, seen 3 batches of students from here. And actually it's an immense pleasure to stand in front of you for this CEP program organized by Physiology Department. And I thank and also wish Dr. Anita Morgan. She is a very efficient person. We have a very close association for a long time. She will organize everything very efficiently. She was our former vice principal in Virudhunagar Medical College. Organizing skill is very rare. Everybody cannot organize very well, but she is exceptionally good in organizing any event. She used to organize many events in Virudhunagar for the whole college, like culturals. Evlo nariya pannuvaanga ma'am. She will do it very well. Okay, and she is very fond of exercise physiology. When we were in Virudhunagar, she was asking me to have a CME on exercise physiology. And for Dean ma'am, usually Physiology Department in THENI Medical College will conduct CEP every year. Without fail, they will conduct. It is not that Basic Science Department don't conduct CMEs. We conduct it every year. And this year also, the topic which she has chosen is very good. Kalari, battlefield. Yeah, it is battlefield. Like day-to-day life, battlefield madri da. You are exposed to all unwanted things which you utilize mostly. You don't take the good things. You take only gadgets, sticking onto screen time, eating all, all pizzas, junk foods. That is, so many things are there. To prevent or to self-defense yourself, I think your physical activity is must. I don't know how many of you do physical activity daily. Most of you will go to gym. As Dean ma'am rightly pointed, you may not know how much to do and all that. So today's session, I think it will throw light on all those things. And physical activity is very, very important for all the students. You should reduce your screen timing, reduce your mobile timing, and you involve yourself in any sports, any kind of exercise. Okay? And as a physiologist, I think skeletal muscle topic, topic. It's a very small topic and very, very important topic also. So in this CME, I think you must learn many things from your speakers. Okay, most, like I also want to stay back and listen to what the speaker says about exercise physiology. Learning for you guys is not a choice. It is your professional responsibility as an IMG, like Indian medical graduate. What NMC expects is lifelong, another learner, lifelong learner. Adanala eppime படிச்சிட்டு தான் இருக்க போறோம். Such profession only you have chose. Adanala you have to listen. You must listen. This is only a once in a, like CME is not conducted daily, is it not? I appreciate all the hangings here. I don't know, I think the students did all this. It is very good. I saw all the poses in yoga poses are placed there. See, I want to appreciate you too much because you have exams ahead in 1 month time and you are able to do all this with wholeheartedly. You have done all that. I'm heartfelt appreciations to 25 batch THENI students. And I wish the CME a grand success. Something which started well will definitely end well. And I again wish Physiology Department a grand success for the CME. It will be a grand success because the department has got very efficient, enthusiastic faculties. Nale perunda kuda, it is a very good department. They will coordinate like anything. Usually they will function as a family. I tell it anywhere, Physiology Department will function as family in any college. And ரொம்ப நல்ல family in THENI Medical College. They will execute everything pakka, no issues. All the faculties are very good and the leadership now is also very good. You have got 2 good professors who is very silently, one professor will work very well and one professor will work outwardly very well. Both of them will work very well and with these faculties they can succeed. They can go for many programs. Thank you so much. I don't want to grab much of your time and all the best for your exams also.
Thank you so much, ma'am.
A person's success is not measured only by achievement but also by the positive impact they create. It is now time to felicitate our honored guest whose hard work and commitment continue to inspire us all. May I request Professor Dr. Anita Mohan ma'am to felicitate our Dean ma'am, Professor Dr. Muthu Chitra ma'am. Thank you ma'am. Now I request our Associate Professor Dr. Hashita ma'am to felicitate our Joint Secretary Association of Physiologists of Tamil Nadu, Dr. Idya ma'am. Thank you ma'am. I request our Senior Assistant Professor Dr. Kalprani ma'am to felicitate our Medical Superintendent Professor Dr. Vijayanand sir. Thank you ma'am. Now I request our Assistant Professor Dr. Usharani ma'am to felicitate our RMO sir Dr. Sivakumar sir.
I request our Assistant Dr. Mahalakshmi ma'am and madam to felicitate our ARMO ma'am, Manimoli ma'am.
ceremony, I extend my heartfelt thanks to everyone present. Let us continue to draw inspiration from the achievement and values of our esteemed guests. Thank you all.
Next, we'll move on to concept mapping. Kindly stay in the dais, ma'am.
Prize distribution.
The Department of Physiology GTMC has conducted a concept mapping competition in
The topic of integrative physiology on 16/6/2026. It was judged by Dr. Shobana Jodi ma'am, Department of General Medicine, and Dr. Anbarasan sir from Department of Pathology, GTMC. We are happy to award the prize to the winners of the competition. I request Dean ma'am to prize to the winners. Third place goes to the team number 19 on the topic concept criteria for diagnosis of brain death and its implication. The winners are Adirai, Ahil Syed, Abarna, Abel Sibi John and Abhiram S. Nair.
Pharmacology எழுதிருக்கேன், pathology நான் எழுதிருக்கேன். பேசாம
Thank you, ma'am. Second place goes to team number 8 on the topic physiology of physical activity, benefits of physical activity, methods to access physical activity, metabolic equivalents of different types of activity. Winners are Praditi A. Kumar, Praveen Kumar, Priya Akshita, Priyadasni and Rahul. Thank you, ma'am. First place goes to team number 11 on the topic of physiology of stress. Winners are Tulasi, Divya Dashini, Gogul Anand, Gogula Vasan and Govardhini.
லேப்டாப் வந்து அவுட் கொடுக்குறேன்னா நேராக காமிக்க அவுட் வேலையை அங்கே ஒரு ஸ்விட்ச் கொடுத்து அவனுக்கு நேரம் எனக்கு இல்லை
Thank you, ma'am. Thank you, dignitaries. Now I request our Associate Professor, Dr. Arshita ma'am, to deliver the vote of thanks.
Good morning to everyone gathered here. First and foremost, we thank the Almighty for His grace and blessings which had made this academic gathering happen today. I convey my heartfelt gratitude to our beloved Professor and HOD ma'am for giving me this opportunity. On behalf of the Department of Physiology, I sincerely express our gratitude to our Honorable Dean ma'am for inspiration and encouragement she has given for organizing this CEP. Thank you, ma'am. We are grateful to our respected VP ma'am, MS sir and Deputy MS sir for their administrative approval and support. Thank you, ma'am and sirs. We also extend our sincere thanks to our RMO sir, ARMO ma'am and sir for their valuable guidance. I extend my sincere gratitude to Joint Secretary of APT, Dr. Ethia ma'am, who honored us with her presence today. My heartfelt thanks to our esteemed speakers, Dr. Jansi ma'am and Dr. Senthil Kumar sir and chairpersons for sparing their valuable time to enlighten us with their knowledge. We are also deeply thankful to our judges, Dr. Swapna Jyoti ma'am and Dr. Anbarasan sir for evaluating concept maps. I also thank our judge, Dr. Shankareshwari ma'am, for accepting our invite to conduct micro-teaching skills contest for faculties. I thank all the dignitaries and delegates from other colleges for gracing this occasion online and offline. To all the professors, associate professors, assistant professors and tutors from various departments of our college, thank you for your support and presence. I thank CRMIs and PGs for being a part of this CEP. I would like to express my heartfelt thanks to my dear colleagues who worked tirelessly with unwavering dedication to make this event a grand success. I would also wish to thank the non-teaching staff of our department, the Sumit workers, audiovisual and live streaming team for their help throughout. Last but not the least, I thank all the Phase 1 students for making the event lively with your enthusiastic participation and student volunteers of Council Batch for your support in organizing this program. Thank you one and all.
Thank you, ma'am. Let's move on to the next academic session.
Moving away, we are about to commence the session 2 of our continuous education program, Kalari 2026. Moving forward into scientific deliberations of the day, session 2 focuses on crucial and highly practical aspect of modern physiology, modern exercise testing and functional assessment. To preside over the insightful session and guide the discussion, it is my absolute honor to invite our distinguished chairpersons, Professor and Dr. Tirunavukarasu sir, HOD, Department of Medicine, Government THENI Medical College, and Dr. Venkatesh sir, Associate Professor, Department of Medicine, Government THENI Medical College, to chair the session.
Good morning, sir. So first of all, we congratulate the Department of Physiology for conducting this wonderful CME on exercises named Kalari. And I also thank the Department of Physiology for giving this opportunity to chair these sessions. So after having gone through the physiology of exercise by the eminent HOD of Physiology from Thuthukudi Medical College, now we are going to the second session where we are going to see the methods of evaluation and functional assessment of exercise capacity in day-to-day practice in patients. So we are encountering so many patients in medical wards, in orthopedic wards, in surgery wards, who are going to be again resume back to their life, whether they are able to do their day-to-day activities, whether they will be fit for their sports, whether they will regain their normal activities. That is what is being done by the modern exercise evaluation and functional assessment. So for that we have an eminent speaker, Dr. Senthil Kumar Subramanian, who has 18 years of experience and is currently the Associate Professor of Physiology in AIMS Madurai, and he has given a lot of textbooks and a lot of papers in his credentials. So over to you, sir.
Thank you for the wonderful introduction, sir. Good morning to one and all. Okay. First of all, I want to thank the Department of Physiology, THENI Medical College for giving the opportunity to address this august audience. I will wish to thank the dignitaries on and off the dais. So, my talk here is today on exercise physiology. I will want to start with the words of the Dean Madam. When the Dean Madam was telling most of the doctors will also suggest exercise. I want to start from the word suggest. We are confident in prescribing the drugs. Why not exercise? So that's where my talk lies. So that's what I want to take forward. The next word from Dr. Vidya Madam was telling learning. It's a lifelong learning. So it will be an interactive session. I would expect the answers from the students. Only if the answers are coming, I will move to the next slide. Okay? Students who are having mobile phones, please take it out and keep it in your hand. You can search in your AA, use your notes. Start taking notes in your mobile phones. Okay? I will just point out somebody and ask what has been taken in the previous 5 minutes. Please take out your mobiles. I'm really telling. Take out your mobiles, keep it in your hand, keep it in silence. Okay? But you have to take notes. I will be keep on asking questions, otherwise you will start sleeping. Okay? This is like an interactive lecture mode, so please be ready. I will ask the last row person also. I will point out and ask. Okay? So what is learning? Physiology. What is learning? Exam is going to be in 1 month. Definition of learning. Anybody has to answer, otherwise I will not move. I will keep on asking. What is learning? Anybody? First row. What is learning? Yeah, what is learning? Yeah, you only. Yeah, any definition. That's AI பார்த்துக்கோங்க, ChatGPT, Kalari, use anything. Just answer my question. What is learning? Yeah. Learning is something which has to bring about a change in your behavior. Otherwise, it is not learning. It is just reading. If it is not going to bring about a change in your behavior, it is not learning. And you have to be a lifelong learner. So let us start from here. So whenever I am moving to the slide, if you are not answering, I will not move next. Okay? I am repeatedly telling. Okay? Take out your mobile, search Claude, ChatGPT, Gemini Pro, whatever you want. I want the answers. Okay? So what do you do now? What are the things that is coming to your mind? If you have notes, start writing what are the questions you will ask. If you have mobile phone open, in the notes you write what are the things you will ask to the patient. Or anybody, your friend, your father and mother can ask, your neighbor can ask. What you are going to write in that? Think for 10 seconds. What are the questions you will ask? It is not only for MBBS students. It can be for all health professionals. They will ask you what exercise I have to do. If they are sitting, what you will ask. Okay. Many of you told what is your age, what is your weight, do you have any problem? Yes, these are the questions we will be thinking to ask. Yes? This will tell what disease they have. What we want is this. How much can they do actually? How hard, how often, and what type of exercise they have to do. Are they ready to change? This is an important point. Are they ready to change? Is it safe to start? Again, madam was telling somebody is enthusiastically going to gym and they are dying in the gym. So that's where we are little bit afraid to write the prescription of exercise, whether we can proceed forward. Is it safe to start? Are we asking these questions? That's the gap, okay, for suggesting exercise to prescribing exercise. Okay, for that what you need? Assessment. So my first half of the topic will be on assessment. What are the questions you have to ask? How will you assess? Is it safe to proceed? Okay. So don't worry, with the end of this talk you will have few tools. You will not become a master, but you will know where to look for and what to look for before prescribing an exercise. Okay. Do you hear now? சரி, இதை பார்த்தோன்னே என்ன தோணுச்சு? இதை பார்த்தோன்னே என்ன தோணுச்சு? ஃபர்ஸ்ட் we will also do ஒரு மேரத்தான் ஓடி பார்க்கலாமா? எஸ்? ஓகே, let us meet Arjun, உங்க colleague. ஓகே, blood pressure 118/76 நார்மலா? நார்மலா இல்லையா? அப்ப எஸ் ஆர் நோ சொல்லணும், மூவ் ஆக மாட்டேன். எஸ் ஆர் நோ? ஓகே, ஹார்ட் ரேட் 72 நார்மல், BMI 22 நார்மலா? ஓகே, ECG நார்மல் சொல்லிட்டேன்பா. ஓகே, டாக்டர் ஐ வாண்ட் டு கெட் ஃபுட், should I start running? என்ன சொல்வீங்க? 22 years start running, what's wrong? ஓகே, அப்புறம் தான் சொல்றாரு மூணாவது ஃப்ளோர் ஏறதுக்கே மூச்சு இறக்குது சார். ஓகே, 2 minute brisk walk போனா ஒரு மாதிரி breathless-ஆ இருக்கு. ஓகே, 8 chair stands in 30 seconds. chair stand என்னது? சேர்ல உட்கார்ந்திருக்கீங்களா? எந்திரிச்சு நிக்கணும், அவ்வளவுதான். 30 செகண்ட்ல 8 தான் பண்ண முடியுது. Now what will you tell? Okay for running? Clinically normal is not the same as functionally ready. Doctors இங்க தான் நம்ம மிஸ் பண்றோம். clinically நார்மலா இருக்கு, are they functionally ready? Okay, take home message. Okay, so exercise testing spectrumல எங்க ஸ்டார்ட் பண்ணலாம்? Let us start with observation. நம்மள பார்க்க வரப்ப you know how they are walking, you will get an assessment starting from there. Observation. There are some few field tests which you can do. Okay, have you heard about 6-minute walk test? Yes? கோவிடுக்கு முன்னாடி அவ்வளோ ஃபேமஸாக இல்லை. Immediately in the COVID period, 6-minute walk test became very, very famous because it will determine whether the patient will survive or not. Exercise testing has such a capacity to decide. Triage பண்ணுவாங்க, the patient survive ஆவாங்களா, டைம் ஸ்பெண்ட் பண்ணலாம் வேண்டாம். அதுக்கு 6-minute walk test was useful. So exercise testing is not simple. Okay, chair stand, this is for young people. Okay, we'll come back to that. So those are called as field test. Okay, there are something called submaximal test. Okay, go for Harvard step test பண்ணிருக்கீங்களா? Physiology we have a practical called Harvard step test. Okay, modified form is Chester step test and bicycle ergometer. This is called a submaximal exercise. Okay, this can determine to find out your VO2 max. What is VO2 max? Your previous lecture was on that. One slide was on VO2 max. GTMC madam. What is VO2 max? Answer பண்ணுங்க. கையில மொபைல் ஃபோன் இருக்கு, chat GPT இருக்கு. VO2 max ஆன்சர் பண்றீங்க. What is VO2 max? எடுங்க மொபைலை வெளிய எடுங்கன்னு சொல்லி நான் விளையாட்டுக்கு சொல்லல. எடுக்கலனா பேச மாட்டேன். மொபைலை எடுத்து VO2 max என்னன்னு பார்த்துட்டு பதில் சொல்லு. What is VO2 max? பாருங்க. டக்குனு தேட தெரியணும். ஜெனரல் ஃபாலோ மொபைலோட பிறக்கிறீங்க, ஆன்சருக்கு மட்டும் எவ்வளவு நேரம் ஆகுது? வரலையா? நெட் இல்லையா? இங்க ஒரு நெட் கொடுத்துருக்காங்களாமே, உங்களுக்கு அக்சஸ் இல்லையா? ஓகே. Some VO2 max na amount of maximal oxygen that can be taken up during the exercise that will determine your exercise capacity. It is one point, VO2 max. அது பார்க்கிறதுக்கு sub maximal exercise பண்ணுவாங்க. Okay, இது யூசுவலா டாக்டர்ஸ் பண்றது இல்ல. Let us go for maximal lab. Graded exercise testing கேள்விப்பட்டிருக்கீங்களா? treadmill exercise testing cardiology ல பண்ணுவாங்க. That is called as stress treadmill exercise. Okay, next one is CPET, cardiopulmonary exercise testing. Graded exercise testing cardiologists பண்ணுவாங்க. ECG angina இருக்கா இல்லையா டவுட்டா இருந்தா when will you do CPET, that is called as cardiopulmonary exercise testing. ரெண்டுக்குமே டிஃபரன்ஸ் இருக்கு, ரெண்டு ஒண்ணு கிடையாது. Cardiopulmonary exercise testingல along with the respiration you will go. Why and when will you do that? Okay, so exercise testing has various stages starting from observation, field test, submaximal, maximal, clinical or not. Okay, so simple, free, always available to, complex, costly, specialty testing. Okay, so real question, not which test is best, but which test is right for this patient in this setting and which you can do. CPET is better for everything. எல்லாருக்கும் CPET இருக்குமா? அவ்வளோ எக்யூப்மெண்ட், அந்த CPET எக்யூப்மெண்ட் வந்து 1.5 கோடின்னு நினைக்கிறேன். It has to be. Okay, so இது தெரிஞ்சிருக்கணும் உங்களுக்கு என்னென்ன இருக்குன்னு. You have to know what are the things available there, what are the various exercise testings available. Okay, but what we can do, that is the difference. Okay, graded exercise, CPET, 6-minute walk test, Chester, FMS is functional movement screening. நீங்க physiotherapy போனீங்கன்னா they will be doing functional movement screening. Okay, grip strength, chair stand and gait speed we can do. Okay, I think grip strength is there in physiology practical also. Grip strength will be there in physiology practical. Okay, CPET apathy first we will go. When we will do CPET, cardiopulmonary exercise testing, when it is useful. It is not just limited to physiology. When we will go for 52-year-old man, 3-month exertional breathlessness. என்னென்ன டெஸ்ட்லாம் பண்ணுவோம்? We will take X-ray, we will take ECG, we will take echo. Even after doing that, they have a doubt. They don't know, it may be cardiac, it may be respiratory, maybe both are involved, maybe one is more than the other. Problem in treatment. If cardiology has to be leading, then the treatment will be different. If respiratory is going to be the leading cause, then the treatment will be different. There are few cases in which CPET has to play a role and it will give the values. Anaerobic threshold, new word, jargon. VU, VCO2 slope, new jargon. What is oxygen pulse? All looking like jargons. Okay, let us simplify it. Anaerobic threshold என்னவா இருக்கும்? When you do an exercise, what is the aerobic glycolysis? What is anaerobic glycolysis? Physiology and biochemistry. First year கண்டிப்பா தெரியும். I am not going beyond that. Aerobic glycolysis என்ன? You will take in oxygen, utilize the oxygen, mitochondria Krebs cycle போட்டுட்டு you have to give the energy out. What is anaerobic? In the absence of oxygen எங்க நிக்கும்? Mitochondria குள்ள போகாது. It will end in lactate. Okay, that will be your anaerobic glycolysis. Very good, very good. So what is the difference between anaerobic and glycolysis? Anaerobic and aerobic. One is oxygen, other one is non-oxygen dependent. When will you move from oxygen to non-oxygen dependent? When the exercise slowly start பண்றப்ப you will start with the ATP, creatine phosphate, then aerobic, கொஞ்சம் strength அதிகமானோம்னா it will move to anaerobic. Lactate will be formed. What is the problem with lactate? It is acidic. Once the acid is formed in the body, what is the next immediate step? Physiology. It has to be buffered. Bicarbonate buffers. Bicarbonate buffer panachina, what is the extra that will come out? CO2 will come out. That's where the threshold starts. So in the beginning, oxygen intake and carbon dioxide output will be equal in less effort exercises. If the effort just increase, oxygen intake and carbon dioxide output will be more because buffer systems are involved. So for carbon dioxide to exhale out, your respiratory system has to work more. That's why it is called as VT1, ventilatory threshold 1. Appa VT2 is what? 1 and 2. When your buffer system is overwhelmed and your pH is not under control and the pH is beginning to drop down, the pH will directly act on your respiratory system to stimulate more, even further, beyond the CO2 capacity. That will be called as VT2. These are the two thresholds. We will come back. Okay? We will come back to that. What is talk test and why I am talking about VT1 and VT2 slow elaborately. So remember, when I come into talk test, I will ask what is VT1 and VT2. If you want, write notes and keep. VT1 is where oxygen to carbon dioxide increase buffer system start achina, that is VT1. When the buffer system is failing and pH is falling down, there will be VT2. Okay, so it will give anaerobic threshold 38%, VE VCO2 slope 41, and oxygen pulse, oxygen consumed per heartbeat is flat. So we can determine that there is both respiratory and cardiac. Yeah, yearly 80 and the flat oxygen pulse, cardiac limitation, refer cardiologist, not a bronchodilator. So cardiology is more. So exercise testing in CPET, we can even determine to such a complicated case whether it is cardiac or respiratory. Okay? And we don't have CPET. Tomorrow in OPD. You are sitting in OPD. What you can do? Exercise prescribe. Can we ask everybody to go for CPET then start exercise prescription? Is it possible? Okay? We'll start with PARQ. What is PARQ? Physical Activity Readiness Questionnaire. Okay? So 7 questions, 2 minutes, used by every exercise professional in the world. It is a self. If you are exercise start the 7 questions they can start exercise. That's all. Okay? If the answer to these questions for all 7 questions is no, they can start exercising. That's all. As simple as that. This is not told by me or anybody else. This is given as ACSM, American College of Sports Medicine, who is the appellate authority of all the exercise physiology. Even WHO follows ACSM. Whatever the recommendations given, even the Fitness India movement recommendations is following ACSM. Fitness India movement, the recommendations are given by Physiology Professor Dr. K.K. Deepak was a part of it in determining the Fitness India movement. The recommendations are derived from American College of Sport Medicine and they have recommended this. Okay? Heart condition diagnosed, chest pain during activity, chest pain at rest, loose balance or dizziness, bone or joint problem, heart medication, any other reason not to do exercise. Answer for all these questions is no, you can start exercising. 7 questions. Okay? If you can scan the QR code, actually I have given a link to the PARQ, you can fill it up. Okay? We'll start with tool 1. At least what is PARQ? Physical Activity Readiness Questionnaire. Pakkathile or chinna plus varum. Okay? Each question maps to a physiological risk. That's why it exists, the questions. Yes in badal sonna enna pandrathu? No sonna they can start exercise. Yes if they are answering, what you will do? Refer to a doctor. So they can do a self-screening. If they answer even 1 yes, they have to consult a doctor before starting an exercise. So this questionnaire can be given to the community to start an exercise. Okay, I will not go, when yes means stop doing exercise. Resting BP is more than 180, chest pain at rest, recent cardiac event, acute illness, இதெல்லாம் இருந்தா exercise இப்போதைக்கு ஆரம்பிக்க வேண்டாம். Acute stop. Okay, you should also know when to tell don't do exercise also, because as madam has told, there is some exercise mania should not happen. Exercise has to be carefully crafted for the individual. Other patient screening, இப்போ டாக்டர்ஸ்ட வந்துட்டாங்க. How will you screen? This is called as pre-participation screening. ACSM pre-participation screening. You will ask 3 questions. Current activity level, are they moving or sedentary? What is the definition of sedentary? எல்லாத்துக்கும் ஒரு டெஃபினேஷன் கொடுக்கணும், அப்பதான் ஒத்துக்குவாங்க. 8 மணி நேரம் சும்மாவே உட்கார்ந்திருந்தா அது sedentary ஒத்துக்கலாமா? Okay, without doing any exercise, without moving. Okay, there is a difference between the word physical activity and exercise. The group of people who have got award for physical activity, please tell me the difference. What is the difference between physical activity and exercise? அப்போ வித்தியாசம் சொல்லணும். physical activity exercise தெரியலன்னா நோட் பண்ணி வச்சுக்கோங்க, படிங்க. Any movement is physical activity. Structured physical activity is exercise. அவ்வளோதான் definition. ஓகேவா? So second question you will ask is disease or signs or symptoms. ஏதாவது disease இருக்கா pre-existing, இல்லை இப்போ ஏதாவது symptoms இருக்கா? Second question. Third question, என்ன லெவலுக்கு exercise பண்ணணும்? They will have a goal. I want to do marathon goal. I want to go for even a temple. Recently I went for Ahobilam. I didn't know that I have to climb the. After climbing for few steps, I realized no, this is not. They told just 500 steps more, sir, in the mountain. Then I went after 500. They told just 1,000 more, sir. Okay. I had the. Then I went to Parvadamalai. They told 10,000 steps. It's very, very difficult. So intended exercise intensity. These are the 3 questions you will ask and determine how to prescribe exercise. Okay. Everything is available online. If you just type ACSM pre-participation screening, you will get a table cover. What to do, what not to do. The question starts from what is their current physical activity level. If they are having any disease or symptoms. Current activity is yes. No disease or symptoms, they can start exercising. Current activity is no, then can start with light to moderate, never vigorous. If they have any disease or symptoms, don't start now. You have to go for screening, then start. Follow பண்றது கொஞ்சம் டிஃபிகல்ட்டா இருந்ததுன்னா just note down tool number 2, ACSM pre-participation screening. Okay? கேட்பேன் tool 1 என்ன, tool 2 என்ன. Okay? Which tool, when and what you do. Self screen is PARQ, professional screening is ACSM algorithm. Gym or event போணுமா இல்லையா decide பண்ணிக்கோங்க. Clinical OPD ACSM, maybe get clearance, a decision clear to refer or not, ACSM will give the answers. I don't want to go detailed. Let me move to the next. You have given exercise prescription. Okay? எல்லாருக்கும் தெரியும் exercise நல்லதுன்னு. அதை சொல்லி பிரயோஜனம் இல்லை. Everybody knows. Then why we are not doing? Not we. We are telling to the patient, diabetes, exercise important, hypertension, exercise important. Why they are not doing? What is this 50% is telling? If you tell to 100 people, less than 50 only will do. Okay? Exercise adherence at 12 months, even with full support. சொல்லிட்டு விடுறதில்ல, சொல்லிட்டு விட்டீங்கன்னா 100 பேர் பண்ண மாட்டாங்க. பண்ணிங்களான்னு ஃபோன் பண்ணி கேட்டு ஃபாலோ அப் பண்ணி பண்ணாலுமே only 50% will do. Why? அவங்களுக்கு தெரியாதா? The commonest reason prescription is not the wrong dose. It is prescribing to a patient who was never in a stage ready to receive it. கேட்டாதானே செய்யறதுக்கு. Okay? This is where we are failing. Science behind it. TTM, tool number 3. Trans theoretical model, TTM. Behavior change has stages. அவன் ரெடியாகவே இல்லை எக்ஸசைஸ் பண்ண, அவன்கிட்ட உட்காந்து 1 மணி நேரம் கச்சேரி பண்ணி என்ன பண்ணுறது? கேட்குறதுக்கே அவன் ரெடி இல்லையே, அவன்கிட்ட போய் ப்ரிஸ்கிரிப்ஷன் கொடுத்து என்ன பண்ணுறது? அதுவும் பிஸி ஓபிடி, வி டோன்ட் ஹாவ் டைம். யாருக்கிட்ட சொல்லணும், யாருக்கிட்ட கம்மியாக சொல்லணும், யாருக்கிட்ட என்ன சொல்லணும், when to tell, whom to tell, what to tell. Okay, that will be the behavioral change. Let us start what it is. Okay, transtheoretical model, a validated model how people actually change behavior. Change is not a single event, just start exercising is not going to help. Okay, why it matters? Only works if it matches where the patient is. Okay, let us start with pre-contemplation. Pre-contemplation அப்படின்னா என்னவா இருக்கும்? They are not even thinking about exercise. அவங்க கிட்ட என்ன சொல்வீங்க? What will you tell? Contemplation, thinking, exercise useful ஆ இருக்கலாம். Okay. Preparation, yes, I am ready to exercise, I will take steps. That is the third stage. Action, they have started doing it, just started doing it. Maintenance, going on beyond 6 months is maintenance. எல்லார்கிட்டயுமே பேசணும், என்ன பேசணும்? Okay, pre-contemplation, 50-year desk worker, you mentioned exercise, he shrugs, no time, I feel fine. இந்த ஆள்கிட்ட என்ன சொல்றது? இந்த மாதிரி ஒருத்தவங்க சொன்னாங்கன்னா what we can tell? Don't prescribe, he was not going to use anything. Plant one seed and stop. Exercise is the best treatment for what we have discussed. Raise a gentle dove, don't push. If you force him, he won't even come back to you. Okay, Arjun 2, I know I should, I keep meaning to start, but I am not able to start. Most of us will be there. இந்த பேஷண்ட்டுக்கு என்ன பண்ணலாம்? இந்த சப்ஜெக்ட் ஆசை காட்டணும். Lead with vision. Okay, once you are being good, what you can do, you can show off. Okay, you can go to a trip, you can go for marathon running. Okay, start with a vision. Ask them what is your goal, what is your vision to do. Lead with a vision, not a plan. Explore what's holding him back and what fitness would give him. Keep the balance towards why. Okay, the decision has to be coming from them, not by you. Okay, third, preparation. 45-year teacher bought walking shoes last week, asked how do I start properly? This is the place where you will prescribe. So எல்லாருக்கும் prescription இல்லை, you should know whom to prescribe. Now write the prescription. How to write the prescription? Second talk, we'll come back. Action, 62-year-old post-MI walking 10 minutes daily, 3 weeks since rehab, but he is doing the exercise. அவங்களுக்கு என்ன பண்ணுவீங்க? Review and progress. Increase பண்ணணுமா? 10 minutes walking, can we increase to 20 minutes? If they is walking for 20 minutes, can we make it a mild jogging? That will be done in action stage. Maintenance, they are doing for 6 months. What is the problem in maintenance? They will get bored, they will go for relapse. So how will you prescribe exercise for them? Change. மாற்றி வாக்கிங் இல்லாமல் வேற என்ன கொடுக்கலாம்? ஸ்விம்மிங் கொடுக்கலாமா? இல்லை அது இல்லை ஜம்பிங் ஜாக்ஸ் கொடுக்கலாமா? We have to prescribe, so you have to be more innovative in doing that. Okay, so this is about tool 3 பேர் என்ன? TTMK expansion pa, trans theoretical model. Good. Okay, match பண்ணலாமா? Pre-contemplation 1 2 3 4 5 என்ன நம்பர் மட்டும் சொல்லுங்க. 4 ஆ? ஓகே. Contemplation 2 good. Preparation, write the prescription. Action, review and progress. Okay, yeah, சரி. Tool 3 முடிஞ்சிருச்சா? Now what we can do, grip strength. Okay, thank you. Now we are going to prescribe பண்றதுக்கு என்னென்ன தேவை, எவ்வளவு prescribe பண்ணணும், எப்படி prescribe பண்ணணும். Let us start with hand grip strength. Dynamometer பார்த்திருக்கீங்களா? Hand grip dynamometer. Yes, ரொம்ப சிம்பிளா இருக்கு. இதை வச்சு என்ன பண்றது? Grip strength is a surrogate for whole body muscle mass, metabolic health, and it will determine the cardiovascular risk. Just a hand grip dynamometer. Okay, the hand reflects the whole body. Thedikla, Lancet 2015, done in 5 lakh people, 17 countries including India. Every 5 kg fall in grip strength, 17% cardiovascular mortality and 9% all cause mortality. Grip strength மட்டும். ஓபிடில ஒரு டைனமோமீட்டர் வைக்கலாமா? ஸ்டெத்தஸ்கோப், தெர்மாமீட்டர், ஒரு டைனமோமீட்டர். Simple. On cardiovascular risk you can determine. Your grip strength is less, you have to start exercising. Subject will also know. Previously 10 kg irundhathu, now I am increased to 15 kg. You can tell your cardiovascular risk is coming down just by taking your hand grip strength. Okay? Less than for males 24 kg, for females 18 kg. This is for 65-year-old, not for young adults. Young adults more than 40 kgs. Okay, நீங்க டைனோமீட்டர் எடுத்து பார்த்துட்டு நீங்க 65 ஏஜ்ல இருக்கீங்களா என்ன ஏஜ்ல இருக்கீங்கன்னு பாருங்க. Okay, 68-year-old man, grip strength is 22. What does this tell you? ABCD. Answer ABCD. Normal for age, refer ortho, should not exercise, screen sarcopenia, modify the treatment. Sarcopenia, what is the meaning of sarcopenia? New term coming up. Frailty, sarcopenia. Sarco, muscle, penia, less, muscle is less. Avlodampa. Okay, this happens in old age people. Okay, so he is going for sarcopenia, resistant exercise kudukanum. Okay, why we have to know about the elderly population now? Recently வெள்ளையறிக்கை கூட வந்துச்சு, அதுல முக்கியமா ஒரு வார்த்தை சொன்னாங்க. நம்ம வெள்ளையறிக்கைப்பா ஒரு 2 நாளைக்கு முன்னாடி கொடுத்தது. Are becoming old. Tamil Nadu is becoming, geriatric population is getting more, so we have to learn more about geriatric population. சரிங்களா? Okay. Grip strength. Okay, எழுதிக்கோங்க. Second, gait speed. Zero equipment, powerful predictor. 4 meter. ஒரு 4 மீட்டர் எடுத்துட்டு இன்ச் டேப் வச்சுட்டு ஒரு டைமர் வச்சுக்கலாம். ஓகே, 4 மீட்டர் எத்தனை செகண்ட்ல நடக்கறாங்கன்னு. Walk to that mark at your normal everyday pace, the way you would walk to a corridor. நார்மலா 4 மீட்டர் மார்க் பண்ணிட்டு இங்க இருந்து அங்க வரைக்கும் போங்க, அது சொன்னா போதும். ஓகே, threshold level 0.8 meter per threshold. It will determine your fire mortality rate. ஓகே, இதை நம்ம பண்ணலாமா? வீட்டிலே பண்ணலாமா? ஒரு 4 மீட்டர் இன்ச் ஒரு டேப்பை ஒட்டிட்டு அப்பா அம்மாவை நடக்க சொல்லலாமா? எத்தனை பேர் இந்த ரேஷியோ கீழே இருக்காங்களோ அவங்களுக்கு எக்ஸசைஸ் ப்ரிஸ்கிரைப் பண்ண ஆரம்பிக்கலாமா? which you can do today. வீட்டுக்கு போனோன்னா ஆரம்பிக்க முடியும். ஜஸ்ட் 4 மீட்டர்ஸ் மெஷர் மார்க் பண்ணணும். டைமர் உங்கள் மொபைல்லே வச்சுக்கலாமா? 4 மீட்டர் டிவைடட் பை நம்பர் ஆஃப் செகண்ட்ஸ் டு கம்ப்ளீட் இட். இது கம்மியாக இருந்தால் அவங்க எக்ஸசைஸ் பண்ணியே ஆகணும். வீட்டு வேலை செய்கிறேன்னு சொல்லி பிரயோஜனம் இல்லை. ஓகேவா? Improve gait speed first, strength plus balance plus progress exercise, not running. அவங்களுக்கு ரன்னிங் பண்ண சொல்லலை, start exercising. Will come what to give. Okay, grip strength, gait speed எப்படி மெஷர் பண்றது பார்த்தாச்சு. Okay, 30 seconds start stand, lower limb power. 30 செகண்ட்ல how many times they can sit and stand. This is again for elderly population. Predicts fall risk, sarcopenia, functional power, correlates with lab dynamometry. Lab dynamometry cost தெரியுமா? Isokinetic lab dynamometry. Again 1 crore. We don't need that. We just need a chair to assess the lower limb. Reference range, Arjun 8 stands, well below expected. Okay, even if his age is 22, but it is physical age is more than 65. Okay, இது old people. Young people என்ன பண்ணலாம்? இப்போ எந்த சேர்ல இருந்து நில்லுங்கன்னு நின்றுலாம்ல, எல்லாருமே ஈஸியாக பண்ணிடலாம். மாடிஃபை பண்ணுவோமா? ஒரு கால நிற்கணும். திஸ் இஸ் ஃபார் யங் பீப்புள். ட்ரை பண்ணுங்க. சேர்ல தானே உட்காந்துருக்கீங்க, ஒரு கால எழுந்திரிங்க. ட்ரை பண்ணுங்க. எந்திரிங்க எந்திரிங்க எந்திரிங்க, எல்லாம் தூங்க ஆரம்பிச்சிருவீங்க. சிங்கிள் லெக் ஸ்டாண்ட் ட்ரை. எத்தனை பேர் கம்ப்ளீட் பண்றீங்க? ஒரு கால எந்திரிக்கணும், 2 கால எந்திரிக்கல. உட்காந்துட்டு ஒரு கால நீட்டிட்டு ஒரு கால எந்திரிக்கணும். எந்திரிங்க. யா Okay, good. Sit down. Sit down. Good. Generally between 6.8 to 9 seconds is okay. அதுக்கு மேல ஆச்சு எந்திரிக்க முடியலன்னா okay. Now you know how to assess the lower limb strength. For elderly எப்படி engage. Assessing the strength without a barbell. ஒன் ஆரம் பார்த்துருக்கீங்களா? வடிவேல் ஆக்சுவலாக வருது மிஸ் ஆயிடுச்சுன்னு நினைக்கிறேன். வடிவேல் ஒரு ஜோக்கில் ஜிம் வச்சு நடத்திட்டு இருப்பாரு. வைங்க பார்த்துக்கிறேன். அந்த ஜோக் ஞாபகம் இருக்குங்களா? ஓகே. ரெசிஸ்டன்ட் எக்ஸசைஸ் when you are going to prescribe, how they will tell? You are 80% of the maximum எடுக்கணும் அப்படின்னு. When you are going to ask a hypertensive patient to do resistant exercise, can you say that lift your maximum to a hypertension patient? His BP will shoot. So we cannot do one arm. We cannot ask the subject to show your maximum lift and show, then I will prescribe. You cannot tell that. What is an alternative for that? என்ன பண்ணலாம்? அப்புறம் எப்படி ரெசிஸ்டன்ஸ் எக்ஸசைஸ் பிரிஸ்கிரைப் பண்ண முடியும்? This ஒரு லைட் வெயிட் டம்பிள் ஒரு 5 kg லைட் வெயிட் தானே? இல்லை குறைச்சிக்கலாமா 3 kg? ஓகே. Choose a weight liftable 10 to 12 times where the last 2 reps feel hard but doable. ஈஸி 15 ஈஸியாக பண்ணிட்டாங்கன்னா வெயிட் இன்க்ரீஸ் பண்ணணும். 8 கூட கம்மி பண்ண முடியலன்னா வெயிட்டை ரெடியூஸ் பண்ணணும். அதுதான் அவங்களோட ரெசிஸ்டன்ஸ், எவ்வளோ வெயிட் தூக்கணுங்கிற ப்ரிஸ்கிரிப்ஷனுக்கு. சிம்பிளாக இருக்கா? ஞாபகம் வச்சுக்கலாமா? Okay, if they are able to lift the weight 15 times, then the weight is less for them. You can increase the dumbbell weight. If they are not even able to do 8, reduce the dumbbell weight. Dumbbell illa chest press edhuva irundhalum. Now we get an overall idea how to prescribe resistant exercise. This is the down. Okay, idhuvaraikku ethana paathirukom? Tool 1 PARQ. Tool 2 ACSM. என்ன பாதி பேர் தூங்க ஆரம்பிச்சிட்டாங்க. லாஸ்ட் ரோ. Tool 3 TTM. ஓகே. அசஸ்மெண்ட்ல ஃபர்ஸ்ட் ஒன் grip strength, second one gait speed, third one chair strength. ஓகேவா? fourth one resistant exercise dumbbell கொடுத்துருக்கோம். ஓகே. இது வரைக்கும் ரெசிஸ்டன்ஸ் பார்த்தாச்சு. ஏரோபிக் எப்படி பிரிஸ்கிரைப் பண்ணுவீங்க? How will you prescribe aerobic? Walking or jogging or running? How will you determine mild, moderate, severe? Mild, moderate, severe எப்படி சொல்றது? There is something called RPE, rate of perceived exertion. RPE. Okay? ஒரு ஸ்கேல் கொடுத்துறாங்க. 6 to 8 very light, 9 to 11 light, 12 to 14 moderate, 15 to 16. இந்த நம்பர் யார் சொல்வா? பேஷண்ட் சொல்லணும். நீங்கள் எப்படி ஃபீல் பண்ணுறீங்க? 6 to 12 நீங்கள் எப்படி இப்போ ஃபீல் பண்ணுறீங்கன்னா பேஷண்ட் சொல்லணும். என் நம்பர் இப்போ 12, 14. ஏன் 0லேருந்து ஸ்டார்ட் பண்ணாமல் 6ல் ஸ்டார்ட் பண்ணுறாங்க? Anybody has ever heard about RPE? The first time? Okay. Into 10 போட்டிங்கன்னா ஹார்ட் ரேட் வந்துடும். ஓகே. மாடரேட் எக்ஸசைஸ் இஸ் 120 to 140 ஹார்ட் ரேட். So அதுக்காக they have designed this. There is one more RPE. 0லேருந்து உங்கள் சந்தோஷத்துக்காக. ஓகே. RPE 0 to 10. ஓகே. Rest very moderate, somewhat hard. This number has to be given by the patient. ரெண்டுக்கு வித்தியாசம் இருக்கு. 6 to 20 has to be used for aerobic. 0 to 10 has to be used for resistance training because one is linear, other is non-linear. Okay. Rate of perceived exertion. இது கொஞ்சம் கஷ்டமாக இருக்க மாதிரி இருக்கோ? ஈஸியாக்கிடுவோமா? இன்டென்சிட்டி வித்வுட் எக்யூப்மெண்ட். தேர் இஸ் சம்திங் கால்ட் டாக் டெஸ்ட். டாக் டெஸ்ட் என்ன? எத்தனை பேர் வாக்கிங் போயிருக்கீங்க? கதை பேசிட்டே வாக்கிங் போவோமா? கதை பேசிட்டே வாக்கிங் போக முடிஞ்சதுன்னா அது லைட்டா, மாடரேட்டா, விகரஸ்? நார்மலாக 2 பேர் பேசிட்டே வாக்கிங் போகிறாங்க. Is it light, moderate or vigorous? It is light. Okay, it will not even come under exercise recommendation. நல்லா பேசிட்டே நடந்தீங்கன்னா exercise recommendation நீங்க வரவே இல்லைன்னு அர்த்தம். When you are going for moderate, you cannot speak. பேசுவீங்க, வார்த்தை நின்று பேசுகிற மாதிரி இருக்கு. We cannot continuously speak. Then only you are reaching moderate level. பேசவே முடியலன்னா you are going for vigorous intensity. Simple test. Can we tell this to our patients? நானும் டெய்லி வாக்கிங் போகிறேன் சார், 1 ஹவர்லாம் வாக்கிங் போகிறேன், ஜாலியாக எங்கள் எல்லாரோடைய அப்பார்ட்மெண்ட்டில் இருக்கிறவங்களோட சேர்ந்து பேசிக்கிட்டே போவோம். அப்போனா they are not doing exercise. They are doing physical activity, which is the level of benefit that is going to come out of it is very, very less. They will be spending hours in walking, but the benefit is not going to come out of it. சரிங்களா? The VT1, what is VT1? Ventilatory threshold 1. VT2 is ventilatory threshold 2. What is the basis for VT1? Aerobic to anaerobic buffer systems. VT2, buffer systems are failing. How it is related to talk test? பேசுறதுக்கு என்ன முக்கியமா தேவை? Respiration, breathing. இப்போ ventilation இதுக்கு எக்ஸசைஸ்க்கே போயிடுச்சுன்னா பேச முடியாது. That is the physiological background of talk test. சரிங்களா? So zone 1, VT1. VT2 is zone 2, moderate to vigorous. Can talk and sing, it is very light. Can talk but cannot sing is moderate. Vigorous have difficulty even in talking. Proceed பண்ணிக்கலாம். இது எப்படி prescription யூஸ் பண்ணிக்கலாம்? பேஷண்ட்டை சொல்லலாம் இந்த டாக் டெஸ்ட் யூஸ் பண்ணிக்கோங்கன்னு, இல்லைன்னா ask them to go for a walk for 2 minutes and then come back. Even for 2 minutes if they are huffing and puffing, then you know that 2 minutes walk itself is moderate for them. அவங்க கிட்ட அரை மணி நேரம் வாக் பண்ணுங்கன்னு சொல்ல முடியாது. Start with 10 minutes. Okay? What the problem with this is, at least walk for half an hour. எல்லாருக்குமே சொல்றோம். It won't work. They will try walking for 1 day. They cannot sleep in the night. There will be leg pain, there will be respiratory disorder. Next day அவங்க நடக்க மாட்டாங்க. டாக்டர் ஏதோ தப்பா சொல்லியிருக்கார் போல இருக்கு, நம்ம உடம்பு அவருக்கு தெரியல. They will stop doing it. Start from 10 minutes, slowly increase to 15 minutes. That's where the prescription lies. Okay? 3-minute OPD assessment பண்ணக்கூடியதா? PARQ or ACSM, TTM, whom to prescribe or not to prescribe. Once you want to prescribe, then you will go for assessment. எல்லாருக்கும் assessment பண்ண போறது இல்ல. What are the assessments we have seen? Hand grip, all everything. Intensity, how much we can tell. Talk test based பண்ணி you can prescribe the intensity. Okay? So 3 to 5 minutes. OPD ல extra 2 மட்டும் வைக்கணும். முடிஞ்ச ஒரு நல்ல inch tape, hand grip dynamometer, ஒரு dumbbell. Exercise restriction you can start by tomorrow itself. Nothing more is required. Okay? ஓகேவா? ஓரளவுக்கு ஐடியா கிடைச்சிருச்சா? There are so many things, but I want to simplify it. First half over. Okay? Thank you.
Thank you very much, sir, for that highly illuminating and deeply informative session on functional assessment. I respectfully request our esteemed chairperson, Dr. Tirunavakarasu sir, HOD of Department of Medicine, and Dr. Venkateshwar, Associate Professor of Department of Medicine, Government THENI Medical College, to felicitate our speaker.
Thank you, sirs. Now I request Professor Dr. Prem Kumar sir and Professor Dr. Valli Devi madam to honor the chairpersons. Thank you, ma'am. Thank you, sir. Thank you, sirs. Now we will have a visual treat of yoga, a part of our CEP, by our first year student, Adi Rai. She is a national Wushu and yoga player.
அந்த பிஜிஎம் போட்டுடலாமா? மைல்டா அந்த பிஜிஎம் மைல்டா.
A happy morning, everyone. We are past noon. Yoga is the art and scientific pride of Mother India. It is not merely a sage's task or limited to fitness freaks routine. Here we have Gen Z Adi Rai, a national champion presenting few yoga skills. Hope we all know the another facet of yoga practice. Trivikramasana. Trivikramasana improves flexibility of the hamstrings, hip joints and spine while enhancing balance and coordination. It also strengthens the leg and core muscles and promotes better blood circulation and posture. Next, Ardha Matsyendrasana. This posture improves spinal flexibility and helps maintain the health of the vertebral column. It also gently massages the abdominal organs, promoting digestion and improving blood circulation. Next we have Natarajasana. Natarajasana improves balance, coordination and neuromuscular control by enhancing proprioception. It also increases chest expansion and spinal flexibility, promoting better posture and respiratory efficiency. Next we have Hanumanasana. Stretches the hip flexors, hamstrings and groin muscles, improving flexibility and joint mobility. It enhances blood circulation to the lower limbs and pelvis while promoting balance, posture and muscle coordination. Next on a row, we do have Chakrasana. This asana promotes blood circulation to the brain. Which may improve alertness and concentration. The posture also enhances overall cardiovascular circulation and oxygen delivery to the tissues. Last, Hastapadasana. This asana strengthens and stretches the calf muscles, improving ankle stability and lower limb muscle endurance, enhances venous return from the legs to the heart, promoting better blood circulation and reducing blood pooling in the lower limbs. Thank you, Ananda. Thank you, dears.
Thank Thank you, Adirai. It was a wonderful visual treat.
Moving right along with the momentum of today's learning, we now enter session 3 of Kalari 2026. This session takes a highly contemporary and forward-looking topic, precision exercise prescription in the digital age. To lead this session and moderate the discussion, I have immense privilege of inviting our eminent chairperson, Professor and Dr. Prem Kumar Sir, HOD, Department of Orthopedics, Government THENI Medical College, and Dr. Thiruvenkadam Sir, Associate Professor and HOD of Department of Community Medicine.
Hello. Yeah.
Good morning, everyone. I first of all thank Madam Anita Mohan ma'am for giving me this opportunity to chair the session. Already, you know the speaker. Already had enough introduction, and let him continue the other session.
Thank you. Thank you. Thank you. ஆரம்பிக்கலாமா? Okay. So exercise prescription is a very, very huge topic, and we, the Department of Physiology, want to move with exercise prescription as a separate line itself in coordination with the LSM, lifestyle modification. Exercise cannot be seen as an individual part. It is not a one drug, it's not a wonder drug which can heal everything. What are the components of lifestyle medicine? I will start with stress. To have a stress-free life is the first lifestyle modification we have to require. For that we have to adopt various things. Second one I would like to say is about the sleep. Have a good night sleep. Third is food. Fourth is exercise, according to me. This is not given by some ACSM. This is according to my experience which I am sharing. Then comes your substance abuse, and have a social connectedness is a part of LSM, lifestyle. You should have a friend to talk to. You should have a home to go back, which can lead to a healthy life. Have you heard about blue zones? Blue zones. Nobody, yeah? யாராவது ஏஐ வச்சிருந்தீங்கன்னா chat GPT இந்த blue zones தேடுங்க. What are blue zones? Blue zones are the area where the people live beyond 100. Okay, they have determined what are the lifestyle they are having, and they want to adapt to the other zones so that we can have a longer life, not survive, have a longer life. Both are different. Okay, we know how to survive with drugs. We have to live. Both are different. Okay, let us start with that. Prescription. Digital era. Okay, we have all of us have smartwatch, all of us have step count, what to believe and what not to believe. Heart rate, can you believe? Given by the watch. Now recently most of the watches are giving accurate heart rate count. Almost most. Okay, SpO2 also most. Why we are accepting this? Because these are measured values. Your watch is measuring the heart rate. There is a difference between measuring and estimating. Okay, what is estimated? VO to max, calories, everything will be given by your watch. Fitness, age, don't believe that. These are estimated. These are formula derived ones. Okay, what not to believe entirely impossible is, it cannot tell what are the contraindications you have. It will not know about you unless you give it to it. What are the medications you are taking? Okay, simple. Heart rate you are going to prescribe to your patient. What is the moderate intensity heart rate you will say for an exercise? He is having a watch, so we can monitor the watch and walk briskly. What is the moderate intensity heart rate? Answer. Again you will go for sleep. If you are answering, I will finish fast. We can go for lunch. If you are delaying, I will also delay. Answer. What is the moderate intensity heart rate? Guess. 100க்கு மேல 150க்கு மேல இல்ல 2க்கு நடுவுல range. Physiology always range. 120 to 140 because already RP you told. Okay. If the subject is taking beta blockers, 120 to 140, okay, va? Can your watch tell that? So you should know when to prescribe, what to prescribe, how to prescribe also. Okay? That's the danger in digital era, but it is a boon to also. You can simply prescribe. If it's a healthy individual, ask him to follow the watch. If he is taking medications, we are the person who have to inform the patient what to watch for. Okay? Generic plan is given by whenever you ask, and now we have AA. ChatGPT, I am 25 years old. Okay, I am not 25, but 25 years old. Prescribe exercise for me. Will it give? Definitely it will give. Then I will tell I am a male. Will you change the exercise? It will change the exercise. Okay. Then I am saying South India. Will you change the exercise? It will say, are you willing to do yoga? It will start asking questions like that. Okay. So it cannot prescribe for you unless otherwise you give more information to it. If you give garbage in, only garbage will come out of an AA. AA models are not still robust enough. It will answer to your questions. If you give more information, better the output, but still we are not there. We are not there. Please don't blindly go with ChatGPT or any of the AA till now. It is getting developed. Many of the robust systems are there, but not yet. We are not yet there. Okay? Arjun is there. Okay? Should I keep going with the YouTube plan for run every day? You have all the tests. All clear, park you. Resting heart rate 88. BMI is 26. Grip strength is 32. Normal? Somewhat normal for this age. It has to be beyond 40. Gait speed is 1.1. Is it normal? What is the threshold value? Gait speed, come on. Otherwise this session will be boring. 0.8. Okay. Chat stand. 8 is low. Yes. Talk test failed sentence. Brisk walking itself he is not able to do. TTM stage contemplation. Now we have every information. Can you prescribe? What are the things you will concentrate? What will you tell? What is this gap? What is the silence? You know what to do. He has to exercise. You don't know the goal. What is the goal? What is the goal? He has to run. That is not the goal. For an healthy individual to lead a healthy life, what is the exercise prescription? What is the exercise that has to be done to have a healthy life? Is there any body which is giving the guidelines for that? Name one institution which is going to give that. ICMR. NA. Morning itself we told. American College of Sports Medicine. WHO is following that. CDC is following that. Even Fitness India movement is following that. So can you search what is the guidelines given by ACSM? If I tell you will forget. Search now, search and tell me. Search and tell me. What is the exercise guidelines given? Search. Otherwise you will forget. Once you are out of this room, you will forget. We will wait 5 seconds, 10 seconds. Sir? ACSM health guidelines. ACSM health guidelines. What are the two types of exercise we know? Aerobic, resistance. How much aerobic is required? How much aerobic is required? சொல்லுங்க 150 to 300 minutes. What intensity? Moderate. Okay. Resistance exercise 2 to 3 days per week. Aerobic. So guidelines is minimum of 150 minutes of moderate intensity exercise, which you will be doing accumulative of 5 days per week. 150 is not for one day. 150 is over the 5 days period. Okay, and resistance at least for 2 days a week you have to do. Okay, now Arjun, what will you say? What are the things you have to tell? Is this information enough to start exercise prescription? When you are writing a drug, what are the things you will write? Name, then dose, then dose is milligrams, then when to take, before or after food, interactions are there or not. Yes, so exercise should also have something like that. Okay, we have this. Okay, fit VP, FITT VP, write it down, FITT VP. What is F? Getting guess? What is F? Frequency. Okay, I is intensity. Okay, T is how long, duration of an exercise. Okay, type of exercise, aerobic or resistance. V is volume, P is for progression. Okay, please write it down because you are going to prescribe for the next case. We will do together for Arjun. Next case I will tell, you have to tell what is FITT-VP. Okay, write it down. Okay, frequency. What is the prescribed frequency according to ACSM? 5 days week aerobic exercise. Intensity is moderate. Type is aerobic. How much? Duration. Let us start. More than 5 days moderate intensity, or if you are going to do vigorous exercise, 3 days is enough. Okay, minimum stimulus frequency to build and keep adaptations. Please, this is a take home message. Those people who are walking jollily for 1 hour, they are not even coming under this. They are not even coming under this. Okay, any form of exercise is good for health. They are at least doing that. That is good. But if you want a healthy life, we have to do something more, slightly more. Okay, intensity. For intensity we have talk test. Okay, we can have heart rate maximum if they are wearing the watch. If they have educated, we can go for RPE. If nothing, we can go for talk test. That we can do. Intensity. This is really important line. Okay, more than 30 minutes moderation. 150 minutes I will do only on Sunday and leave the rest of the days free. Will it be okay? Because I have seen people like that. New faddism has come. Sunday morning they will take a cycle and they go for 60 kilometers marathon cycling. One day. Every Sunday they will go for marathon running for 42 kilometers. Remaining 6 days they won't move. That is not going to be good. That's why I am saying frequency. 5 days per week. 150 minutes you have to accumulate. Meaning daily 30 minutes of moderate intensity has to be there. Is this 30 minutes continuously you have to do? I don't have time, sir. I am very busy. 2018 they have told do for 1 minute. Okay, do for 1 minute. Accumulate over the period. 30 minutes per day is enough. Even for 1 minute of moderate exercise is enough. That will give you health. There is one more benefit is there. Okay, what is sedentary life? Sitting in a place without moving. There is a problem created by the gym people. They will sit continuously for 12 hours, then they get up and go for gym and do for 2 hours. they are at high cardiovascular risk of dying in gym also, because they are sitting for 12 hours without moving. So they are telling that doing a physical activity is important, but breaking the sedentary is equally important. This is a take-home message. Please write it down. If you are not taking anything else, please take this down. Breaking the sedentary is equally important. So if you are going to sit for 1 hour, break. Every 20 minutes you have to give a break, get up and walk. That's why many of the village people who are not sitting and not doing exercise in the gym are very healthy, because they are not having a sedentary habit. They will keep on walking. Okay, breaking the sedentary habit is equally important. Okay, how to do that? Sir, I am sitting in a lecture class for 1 hour. How I will do exercise? You should ask, no. Next class, next teacher has come. I am sitting. Next teacher, I will do sitting itself exercise. How I can do? Give practical solution, no. Okay, what is Soleil's exercise? Have you heard about Soleil's exercise? Calf raise. Now you can do. Start doing calf exercise. Can you raise your foot? Do Soleil's exercise. Not lifting the knee, just the calf. That is called as Soleil's exercise. That is again the international publication in Nature. Doing a Soleil's exercise can bring down your, even in diabetes, the glucose levels. Just doing Soleil's exercise. Okay. Government of India, I think since it is state government of India has told how to do chair exercise. Chair yoga has been introduced. Okay. You can go to the YouTube and search how you can sit and do exercise. Okay. So please do those things. Breaking the sedentary is equally important. That's why I have spent so much time in the point number 3. Type follows assessment. His lower limb is weak, give more of the lower limb. His upper limb is weak, more of the upper limb concentration. If the balance is weak, give balance training. Volume, accumulation of 150. Progression, 10% rule. Progression has to be there. You have to review the subject. You will not just prescribe and leave. If you are going to give a drug, you will tell that, no, that automatically comes to you. Okay? Exercise also like that. You prescribe and you will not forget. You will ask the subject to come back, review and revise your prescription. This is equal to that of drug. In some places, it is more important than drug also. In few places. Okay? FITTP tells what to prescribe. ACE mover tells you how to make them do it. TTM Patama, what are the stages of TTM? Please be louder, otherwise you will start sleeping. Please be louder, loud. First stage, pre-contemplation. Second stage, contemplation. Third, preparation. Fourth, action. Fifth is maintenance. என்கிட்ட என்னென்ன பேசணும்னு பார்த்தோமா, எப்படி பேசணும்னு பார்க்கலாமா? That is ACE mover. MOVER, write it down. Patient எப்படி பேசணும்? Move the conversation. Open questions first. Build trust, not a data sheet. இருக்க டைம்ல இதெல்லாம் பண்ண முடியுமா சார்ங்கிறத கேள்வி. But still, that's why you please send the patient to Physiology department. We will take care of exercise prescription. We have few time to spend with the patient. So all of the department can send to Physiology department. Okay? Open questions, build trust, not a data sheet. You can collect the data, you are going to prescribe based on the data, but if the patient has to follow your prescription, you have to build the trust. Okay? What is the meaning of open-ended question? What is the meaning of open-ended question? அதுவே தெரியலனா அப்புறம் எப்படி? எஸ் ஆர் நோ क्वेश्चन தெரியுமா? நீங்க முட்டாளா இல்லையா அப்படினு கேட்டாங்கன்னா அது எஸ் ஆர் நோன்னு சொன்னா என்ன சொல்றது? எஸ் ஆர் நோ. ஓகே. ஓப்பன்-ended question க்கு ஒரு எக்ஸாம்பிள் சொல்லுங்க. உங்களை பத்தி சொல்லுங்க. This is an open-ended question. ரெண்டுக்கு வித்தியாசம் தெரியுதுங்களா? ஓகே? Let us move. Open-ended listening, receive without judgment. Safety engages planning, not fight or flight. கேக்குறப்பே நீங்க தண்ணி அடிப்பா தானே? If you ask such a question, you have started judging the patient now. என்ன பதில் சொல்வாங்கன்னு எதிர்பார்க்கறீங்க? We are losing the patient. We are here for the patient, to make his life better. அதை நம்ம ஞாபகம் வச்சுக்கணும். We are not here to judge. அந்த behavioral change கொஞ்சம் கஷ்டம், but we have to spend time. Okay? Vision, help them see their healthy future, the contemplator key step. Okay? Engage collaboratively, co-design the plan. Co-design the plan. What they help build, they own. கொஞ்சம் டைம் ஸ்பெண்ட் பண்ணலாமா? What is the meaning of co-design the plan? This is different from a drug prescription. Drug prescriptionல patient உட்கார்ந்துட்டு உங்களுக்கு aspirin எழுதட்டுமா clopidogrel எழுதட்டுமா கேட்க போறது இல்ல. ஓகேவா? But in exercise you can ask, what is the meaning of co-designing? 30 minutes பண்ணனும் முடிவு பண்ணிட்டோம். What will you tell to the patient? If he is a computer worker sitting in a software company, 12 hours, 30 minutes பண்ணனும், how will he do? Come out with ideas. How will you make up the 30 minutes? கார் தூரமாக பார்க் பண்ணிட்டு ஸ்டெப்ஸ் எடுங்க. If he is 10th floor or 12th floor, can he take steps? Lunch period, can he have a break and do walking exercise after coming back? ஓகேவா? இதே இது ஒரு டீச்சர்கிட்ட சொன்னோன்னா என்ன சொல்லுவாங்க? ஏன்னா 4 ஃபுல்லாக நின்றுட்டு இருக்கேன் மறுபடியும். ஸோ 30 minutes of exercise எல்லாருக்குமே ஒர்க் அவுட் ஆகாது. நான் ப்ரிஸ்கிரைப் பண்ணிட்டேன் 30 minutes of aerobic exercise I have written in the paper. No, it is not going to work. If he is a teacher who is going to stand for 6 hours taking classes continuously, அவங்கள போய் மறுபடியும் நடக்க சொன்னீங்கன்னா என்ன சொல்ல போகிறாங்க? So how will you change that? புரியுதுங்களா? That is called as co-designing. அவங்கக்கிட்ட உட்காரணும். ஓகே, உட்கார்ந்து பேசணும். That is called as co-designing. What will achieve from co-designing? What are you going to achieve from co-designing? சொல்லுங்க, what are you going to achieve? Patient will feel that he has decided that. So the chances of him doing is more. சரிங்களா? Reflect and revisit. Check understanding, set follow the monitoring half. நம்ம ஆல்ரெடி பார்த்தது தான். This is called as mover method. Okay? Patient எப்படி பேசணும், என்ன பேசணும். Okay? Exercise prescription, what is required? F, I, T, T, V, P. F is for frequency, I is for intensity, T is for type. Another T? Type ரெண்டு தடவை வருது. Time. V for volume, P for progression. சரியா? Okay. இப்போ இவர் கான்டம்ப்ளேஷன் மோட்ல இருக்கார். இவர்கிட்ட என்ன பேசலாம்? ப்ரீ கான்டம்ப்ளேஷன் பார்க்கலாம். என்ன பேசணும் இவர்கிட்ட? ப்ரிஸ்கிரைப் பண்ணலாமா? Will you prescribe at contemplation stage or you will make him into next stage and then you will prescribe? இப்போ இவர்கிட்ட என்ன பேசணும்? விஷன் கொடுக்கணும். Once you have improved, what you can do? Once you have improved, culturals நடக்குது காலேஜில், உங்களால் brisk walking கூட பண்ண முடியல. If you have improved your physical capacity, you can participate in your cultural activities. That can be his motivation. That can be his motivation. Sports event is coming up. You can participate in sports event. That can be his motivation. Vision கொடுங்க. Once vision is there, he will move to the next stage, that is called as action stage. Then you can start prescribing. Okay? What the data tells. இப்போ prescription, our contemplation வந்து he has moved to prescription stage. Okay? அதுக்கு என்னென்ன டேட்டா வேணும்? Handles moderate intensity, PARQ clear, ஒரு ப்ராப்ளம் இல்லை. ஸோ மெடிக்கல் கிளியரன்ஸ் அளவுக்கு is not want to go. Gait is normal, cardiovascular system seems to be fine. Lower limb strength is weak, chair strength இல்லை. So when you are prescribing, we will prescribe more of lower muscles. Intensity ceiling is moderate, talk test முடியல. Cardiovascular is normal but not functionally normal, clinically normal. So talk test we have to decide. Contemplation stage, we have to move to prescription and then we have to prescribe. So this is the data, how to prescribe. Okay? F என்ன கொடுக்கலாம்? 5 days கொடுக்கலாமா, 6 days, 3 days, 4 days? எங்கே ஸ்டார்ட் பண்ணலாம்? கெஸ் பண்ணுங்க. நீங்கள் கெஸ் பண்ண ஆரம்பிக்கலன்னா டாக் பிரயோஜனமே இல்லை. வாட் இஸ் லேர்னிங் மறுபடியும் ஆரம்பிப்பேன். 3 days a week, non-consecutive. Start from there. ஏன்? Why? brisk walking கஷ்டமாக இருக்குது. 5 days கொடுத்தீங்கன்னா he will not do. He will get fed up. என்னால் பண்ண முடியலன்னு he will go for depression actually. It will not motivate him. Ideal is 5 days, but we cannot start with ideal. Okay? Intensity moderate, but give only for 3 non-consecutive days so that he can recover. Recovery ஆகும். To begin with, he has to recover. We have to be very, very careful with that. Okay? Start with 20 minutes, not 30 minutes per day. Walking in moderate in 20 minutes. Okay? Build over 2 to 3 weeks. 20 if he is comfortable, then you will move to 30. That's the progression over. Split 2 aerobic and 1 resistance. Resistance என்ன கொடுப்பீங்க? Lower muscle கொடுக்க போறோம். ஏன்னா hand grip is normal for you. So lower will concentrate more. Volume 60 minutes per week. 3 days வந்துருச்சா? 60. But our goal is to reach 150. Okay? Progression 12 week. Or 3 monthsல we can bring him towards the ideal goal. 12 weeks ங்கிறது பெருசா இல்ல. Just 3 months. In his entire lifespan, 3 months is nothing. But if he is following the exercise prescription properly, he can become a normal person and lead a healthy life within 3 months. Is it not wonderful? Any drug can do this. We have such a wonderful drug, but we are not yet prescribing this. Okay? Moreover, what would be fitly to you can know that. Then be silent. The answer is your book. உங்களுக்கு என்ன வேணும்? What is your goal that you have to ask? 3 days, 20 minutes, a pace where you can still talk manageable. Can you do that? You are co-designing with Arjuna. Arjunoட பேசுறீங்க, என்ன பண்ண முடியுமா முடியாதா? Tell me what you will do on Monday. What might get in the way? Let's review in 3 weeks. முக்கியமான பிரச்சனை, எனக்கு அடுத்த வாரம் எக்ஸாம் வருது. First thing to go is exercise கட் ஆயிடும். Second thing is cutting is sleep. We are doctors, we are prescribing, but we are the one who are worst patient. Okay, not following any of the healthy activities. So prescribing is one part. Third line என்ன part we are missing? பண்ணாம இருக்கிறதுக்கு என்ன ரீசன்ஸ்லாம் சொல்லுவாங்க, என்ன ரீசன்ஸ்லாம் வரும் கேட்டு ஓபிடிலேயே அதை சால்வ் பண்ணிடும். சார் நெக்ஸ்ட் வீக் ஐ ஹாவ் கோயிங் ஃபார் டூர் டு கோவா, வாட் ஐ வில் டூ? கோவாவுக்கு போய் நடங்க சார் பீச்சில். ரைட் த சொல்யூஷன் then and there. Okay, if he has some other engagement, co-design with the patient. Okay? ஓகேவா? இப்போ நெக்ஸ்ட் பேஷண்ட்டுக்கு எழுதிடலாமா? நீங்கள் தான் எழுத போகிறீங்க. ஓகே, அர்ஜுனுக்கு நம்ம எழுதியாச்சு. ரெடி? ஓகே. மீனாட்சி டீச்சர் 45 years ஆன் அம்லோடிபின். அம்லோடிபின் என்ன ட்ரக்? எதுக்கு கொடுக்குறாங்க? ஹைப்பர் டென்ஷன் இருக்கு. ஓகே. பிபி 148/92, ஸ்டேஜ் 1 ஸ்டேஜ் 2 ஹைப்பர் டென்ஷன். கரெக்டாக எழுதியிருக்கேனா? 148/92 ஸ்டேஜ் 1 ஆர் ஸ்டேஜ் 2? Physiology people, first year. BP normal range. நார்மல் ரேஞ்ச் எவ்வளோப்பா சிஸ்டாலிக்கு? 140 கீழே இருந்தால் நார்மலா? 140 நார்மல் ஆர் நாட்? இஸ் 140 நார்மல்? ஜேஎன்சி 7ஆ ஜேஎன்சி 8ஆ? எதை ஃபாலோ பண்ண போறீங்க? ஜேஎன்சின்னு என்ன? ஓகே. 148 to 92 stage 2. Resting heart rate is 94, BMI 31, grip strength is 24, borderline la irukanga. Gait is 0.9, normal. Chair stand 11, okay. Stage preparation, PARQ 1 years, ena BP irukku. Shall we start prescribing? What is required? F5 TTVP enna kodukalam? F. நீங்களே முடிவு பண்ணுங்க. பேப்பர் இருந்தா எழுத ஆரம்பிங்க. Start writing. I will give you 10 seconds. F5 TTP என்ன கொடுக்கலாம்னு எழுதிருங்க. If you have a mobile, start F-ல என்ன கொடுக்கலாம், 5 days, 3 days, intensity எவ்வளோ கொடுக்கலாம், என்ன மாதிரி intensity கொடுப்பீங்க, start prescribing. Otherwise you will not do tomorrow. உங்கள் அப்பா அம்மாவுக்கு ப்ரிஸ்கிரைப் பண்ணலாமா, சார் நாங்கள் ஃபஸ்ட் இயர் செகண்ட் இயர் தான் ப்ரிஸ்கிரைப் பண்ண போகிறோம். கிவ் இட் யுவர் நெய்பர், கிவ் இட் யுவர் ஃப்ரெண்ட், கிவ் இட் யுவர், எவ்ரிபடி வில் பி காலிங் யூ. MBBS ஜாயின் பண்ணோன்னே ஜாயின் பண்ணாத ஃப்ரெண்ட்ஸ்லாம் கால் பண்ணியிருப்பாங்களே, இந்த டவுட்டு அந்த டவுட்டுன்னு கேட்குறதுக்கு. ப்ரிஸ்கிரைப் எக்ஸசைஸ் ஃபார் தெம், ப்ரிஸ்கிரைப் ஃபார் யுவர் ஃபாதர், மதர், கிராண்ட் பேரண்ட்ஸ், யுவர் ரிலேட்டிவ்ஸ். எஸ், எது வரைக்கும் வந்திருக்கீங்க? டி வந்தாச்சா? எஃப்னா ஃப்ரீக்வன்சி, ஐனா இன்டென்சிட்டி. இன்டென்சிட்டி மாடரேட் தான் கொடுக்க போகிறோம், பெருசாக மாற்ற போகிறதில்ல. டி என்ன டைப், டியூரேஷன் எவ்வளோ கொடுக்க போகிறோம்? 30 minutes கெஸ் பண்ணோம். எவ்வளோ கொடுக்கலாம் இந்த மேடமுக்கு, டீச்சருக்கு? ப்ராக்ரஸ் பண்ணுவீங்களா, எப்படி எடுத்துகிட்டு போவீங்க, டோட்டல் வால்யூம் எவ்வளோ வரும்? எழுதுனா தான் டவுட் வரும், இல்லைன்னா அப்படியே தான் உட்காந்துருப்போம், எங்கேயும் நவர மாட்டோம். எழுத தான் ஏன் எழுத முடியல, எந்த இடத்துல நம்மளுக்கு சந்தேகம் வருது, எங்கே மிஸ் ஆகுதுன்னு தெரியும். ஓகே, shall we start? Intensity we will not going to give vigorous. Vigorous கொடுக்க மாட்டோம், முடிவு எடுக்கும். ஏன்? பிபி இருக்குது ஃபஸ்ட்டு. ரெண்டாவது பார்க்கில் ஒரு எஸ் வந்தாலே மெடிக்கல் கிளியரன்ஸ் வாங்குறது பெட்டர். நம்ம தான் எம்பிபிஎஸ்னால் நம்ம வி வில் டேக் அன் இசிஜி அண்ட் கோ ஃபார் அன் எவாலுவேஷன் பிஃபோர் கோயிங் ஃபார் விகரஸ். விகரஸ் பண்ணணும்னு அவசியமே இல்லை, மாடரேட்லேயே வி கேன் டூ இட். ஃப்ரீக்வன்சி, ஓகே. blood for insulin sensitive effect lasts for 24 to 48, so daily keeps it continuous. இது எதுக்கு நான் போட்டிருக்கேன்? எக்ஸசைஸ் அண்ட் இன்சுலின் சென்சிட்டிவிட்டி, வாட் இஸ் த ரிலேஷன்ஷிப்? We'll come to this later. Exercise and insulin sensitivity, what is the relationship? Insulin sensitivity? Very good. Very good. Very good. Is it insulin dependent or non-insulin dependent? Exercise. Exercise dependent glucose uptake by the muscle is insulin dependent or insulin independent? Insulin independent. Okay, அதனால தான் எக்ஸசைஸ் பண்ணணும். If there is a diabetic who is taking a diabetic drug, if you give him exercise, we'll come back. Okay. How exercise is useful for hypertension? We will discuss that now. Physiologically, when you do exercise, blood pressure will increase. Why we are then prescribing exercise for hypertension? Heart rate, sympathetic activity increase ஆகும் எக்ஸசைஸ் பண்ணா. டேஞ்சர் தானே? என்ன பண்ணுது எக்ஸசைஸ்? Go for bradycardia long term. Immediate effect? Exercise. Okay, very good. Any more answer? I want one more answer. Why exercise is prescribed for hypertension? Anyone? Increases basal artery, decreases, sir சொல்லிட்டாரு, அதான் சொன்னார். What is called post exercise hypotension? Post exercise hypotension. Physiology, again and again, physiology. If your physiology is strong, you will be the best practitioner. What is called post exercise hypotension? Exercise முடிச்சதுக்கு அப்புறம் உங்க BP fall ஆகும். And that fall will last for 2 hours, 3 hours, depending upon your intensity of the exercise and the duration of the exercise. Dose dependent decrease in BP, exercise only can have. Any other drug is very, very difficult without side effect. If you are going to do vigorous activity for 1 hour, BP will be reduced for the next 12 hours. Okay, moderate நீங்க பண்ணீங்கன்னா 6 hours BP கம்மியா இருக்கும். Okay, so peak BP and heart rate which you are achieving during the exercise we can limit, but the benefit will come after the exercise, immediately after also, long term also. Okay, so that is the importance of prescribing exercise for hypertensive patients. You have to prescribe. Aerobic is better than resistance, but you will not avoid resistance also. You have to give resistance. When you are going to do isometric exercise, it will increase your BP. Okay, but you have to give resistant exercise also, but you have to give appropriately. எப்படி கொடுப்பீங்க? Resistant exercise. Dumbbell பார்த்தோமா? You will not ask him to do 1 hour of ஜிம்முக்கு போயிட்டு heavy weight deadlift. No. எவ்வளோ தூக்கணும், எப்படி தூக்கணும், எப்போ தூக்கணுங்கிறத சொல்லி கொடுக்க போறீங்க. That's called as exercise prescription. So if he is hypertensive, she will get benefit from, we'll come to that, 5 days a week. ஏன்னா போஸ்ட் எக்ஸசைஸில் பிபி கம்மியாகும். ஸோ எவ்வளோ நாள் பண்ண முடியுமோ அவ்வளோ நாள் பண்ணணும். ஓகே, மாடரேட் ஒன்லி, விகரஸ் கொடுக்க போகிறது இல்லை. ஹைப்பர் டென்ஷன் இருக்கு. 30 minutes accumulated. She is a teacher. நடந்துக்கிட்டே இருக்க போகிறாங்க. ஸோ காலையில் நீங்கள் நடக்கிறீங்க, அதே கொஞ்சம் வேகமாக நடங்க மேடம் சொன்னாலே அவங்களோட 30 minutes வந்துடும். co-design with the patient. Walking primary, resistance from 3rd week. Resistance கொடுக்கணும். ஓகே, muscle is an endocrine organ. தெரியும்ல? ஓகே, muscle is an endocrine organ. We'll come to that. Start with 150. You can move up to 200. Okay, for few people we'll move up to 300. 300 யாருக்கு போவோம்னா weight management க்கு போவோம். We will not go there, but for this person you can move from 150 to 200 also. Gated by cardiology, stage 2 BP dizziness episodes இருந்ததுன்னா we have to stop. Okay, she is asking this question. 142 heart rate alarm அடிக்குது. What will you tell? Is it dangerous for her? She is getting afraid. My watch is saying 142 and it is high heart rate. Is it dangerous? She stops walking. What will you tell? Is it 140 dangerous? Watching தெரியாது, நீங்க தான் சொல்லணும் 142 dangerous இல்லையா. Okay, 142 measured at steady walking, the sensor is reasonably accurate. Trusted, her heart rate was 142. தப்பில்லை. Label high is impossible. It doesn't know she is 45 on amlodipine, walking briskly, symptom free. 142 is 80% of her maximum. Appropriate, not dangerous. அதை நம்ம தான் சொல்லணும். ஸோ வாட்சில் இருக்க செட்டிங்கை மாற்றி வைங்க மேடம் நடக்கிறப்ப. ஓகே, ரெஸ்டிங்க்கு அலாரம் அடிக்கும் 142 அட் ரெஸ்டிங். அது நடக்கிறோமா இல்லையாங்கிறது என்டர் பண்ணணும். அதெல்லாம் அவங்களுக்கு தெரிஞ்சிருக்காது. ஸோ வி ஹாவ் டு டெல் when to listen to the watch or not. ஓகே, இது ஓகேவா? பிரிஸ்கிரிப்ஷன் ஓரளவுக்கு உங்களுக்கு பிடிபடுதா? எஸ். இவருக்கு நீங்கள் எழுதுறீங்களா? என்ன பண்ணலாம்? 65 years old. லாஸ்ட் கேஸ் முடிஞ்சிடலாம். 5 minutes முடிஞ்சிச்சு. லாஸ்ட் கேஸ், ரிட்டையர்ட் ஃபார்மர், போஸ்ட் என்ஸ்டமினா நான் எஸ்டி செக்மெண்ட் எலிவேஷன் மயக்கோடைன் ஃபர்ஸ்ட் வந்திருக்காரு. T2DM டயபெட்டிஸ் இருக்கு. மெட்ஃபார்மின் அண்ட் கிளைபிசைடில் இருக்காங்க. ட்ரீட்மெண்ட் ஃபார் டயபெட்டிஸ் ரொம்ப காம்ப்ளிகேட்டாக இருக்கோ? எக்ஸசைஸ் பண்ணோமா? அவர் 132 84, ரெஸ்டிங் ஹார்ட் ரேட் 68, BMI 27, sarcopenia இருக்கு 21 kg, gait is threshold, chair stand 6 low, SBP fall risk. SBP னா ஷார்ட் டெஸ்டிங் ஒரு ஸ்டாண்டிங்காக டெஸ்டிங் இருக்கு. ஓகே, ஸ்டேஜ் இஸ் an action. He is ready to do exercise. Son saw a WhatsApp forward, bought a fitness band for 10,000 steps. Is that right for this man? கொஞ்சம் காம்ப்ளெக்ஸ். எழுதலாமா? ஸ்டார்ட் எழுதுங்க. வாட் இஸ் FITTVP எழுத ஆரம்பிங்க. என்னென்னலாம் ஆட் பண்ணணும், என்னென்னலாம் சஜஷன்ஸ் கொடுப்பீங்க? ரிட்டையர்டு ஃபார்மர் 65 years, எஃப் எவ்வளோ? லாஸ்ட் கேஸ் முடிச்சிடலாம். கவனிக்க வேண்டியது என்ன? டயபெட்டிக். அதை தவிர மீதில் கொஞ்சம் சமாளிச்சுக்கலாம். So for a patient with diabetes, exercise எப்படி prescribe பண்ணுவீங்க? காலையில் இருந்துச்சுன்னா வெறும் வயிற்றில் மேரத்தான் ஓடுறது ஓகேவா? டயபெட்டிக். ஸோ when he should do exercise? நல்லா சாப்பிட்டுட்டு லஞ்சு சாப்பிட்டுட்டு அப்போ சொல்லுங்கள், அப்போ எப்போ தான் எக்ஸசைஸ் கொடுப்பீங்க? ஈவினிங் டைம். சாப்பிட்டு எவ்வளோ நேரம் கழிச்சு? 3 hours. சாப்பிட்டு உடனே வா. ஓகே, வயிறில் சாப்பாடு இருக்கக்கூடாதுன்னா மினிமம் 2 hours கேப் இருக்கணும். 3 hours இஸ் குட். ஓகே, எம்டி ஸ்டொமக் ஆர் ஃபாஸ்டிங்கில் எக்ஸசைஸ் பண்ணக்கூடாது. ரிஸ்க் ஆஃப் ஹைப்போகிளைசிமியா வில் பி மோர். ஹைப்போகிளைசிமியா இஸ் மோர் டேஞ்சரஸ் தேன் ஹேவிங் அ டயபெட்டிஸ். ஓகே, ஸோ இந்த மாதிரி எபிசோட் இருக்கப்போ தே வில் பி அஃப்ரைட் டு டூ எக்ஸசைஸ். ஸோ ப்ரிகாஷனுக்கு என்ன பண்ணலாம்? சாப்பிட்டதுக்கப்புறம் பண்ணுறீங்க, இல்லைன்னா கையில் சாக்லேட் வச்சுக்கலாம். என்ன எஜுகேட் பண்ணுவீங்க பேஷண்ட்டை? சைன்ஸ் ஆஃப் ஹைப்போகிளைசிமியா ஐடென்டிஃபை பண்ணுறதுக்கு எஜுகேட் பண்ணணும். டக்குன்னு வேர்க்குதுன்னா எக்ஸசைஸில் வேர்க்குதா ஹைப்போகிளைசிமியாவில் வேர்க்குதாங்கிற அந்த டிஃப்ரென்ஸ் பேஷண்ட்டுக்கு தெரிய ஆரம்பிக்கணும். அது நம்ம சொல்ல முடியாது. You have to start teaching the patient how to recognize the symptoms of hypoglycemia. எக்ஸசைஸ் பண்ணுறப்ப வேர்க்கிறது வேறு, ஹைப்போகிளைசிமியா வரப்போ ஆட்டோமிக் சிஸ்டம்ஸ் ட்ரிகர் ஆகும். அதை அவங்க ரெகனைஸ் பண்ண தெரியணும். தட் வில் த டீச்சிங் பார்ட் ஆஃப் இட். ஓகே, எஃப் ஸ்டார்ட் பண்ணலாமா? 5 days டயபெட்டிஸ் இருக்குது, எவ்வளோ நேரம் எக்ஸசைஸ் பண்ணாரோ அவர் நல்லது. ஓகே, லோயர் ஸ்டார்ட் பாட்டம் ஆஃப் மாடரேட். மாடரேட்லேயே ரேஞ்ச் இருக்குது because he is having NSTEMI, myocardial infarction. Okay, aerobic 20 to 40, resistance also there. Usually post rehabilitation resistance they will not give, but now it is prescribed resistance has to be given at an appropriate dose. Primary is resistance, not even aerobic. Okay, balance is also there. Most of the old age people, fall risk is there, which is the most common cause of hospitalization. Balance miss on. So that exercise prescription பண்றப்ப we have to take care of that also. One thing which I am not touching is flexibility and balance. அதை அப்படியே அவாய்ட் பண்ணியிருக்கேன். But when you prescribing you have to take care of that also. Flexibility and balance also. 150 to 200 minutes per week. Slow 10% rule. Review after 4 weeks. அர்ஜுனுக்கு என்ன சொன்னோம்? ப்ராக்ரஸ் பண்ணி 8 weeks தள்ளி கூட பார்க்கலாம். பட் ஃபார் திஸ் பேஷண்ட்ஸ் த ரிவ்யூ ஹேஸ் டு பி ஷார்ட்டர். முடிஞ்ச 2 weeks கூட பார்க்கலாம், 4 weeks கண்டிப்பாக பார்த்துருக்கோம். ஓகே, ஓரளவுக்கு ஐடியா வந்திருக்கா? எஃப்ஐடி டிவிபி. ஓகே, what is the most common reason doctors don't prescribe exercise? Is that they don't exercise themselves. ஏன்னா இருக்க எல்லா ரீசனும் சொல்லுவோம். டைம் இல்லை, எக்ஸாம் வருது, ஓபிடியில் 500 பேஷண்ட் நிற்கிறாங்கிலிருந்து ஆரம்பித்து எல்லாமே சொல்ல போகிறோம். ஓகே, யூ கேன் டூ ஒன் ஹோம்ஒர்க். ஃபில் யுவர் ஓன் ஃபிட் விபி. கேன் யூ டூ தட்? அடுத்தவங்களுக்கு எழுதுறது இருக்கட்டும், முதல் உங்களுக்கு எழுதிட்டீங்களா? டூ யுவர் ஓன் அசஸ்மெண்ட். Do your fit VP. Start from there. Co-design with yourself. பண்ணுவியா மாட்டியா? பண்ணாமல் இருக்கிறதுக்கு என்ன ரீசன் சொல்ல போகிறேன், அதுக்கு என்ன சொல்யூஷன்? Start writing. Then you will start moving. Okay? Thank you. Thank you for the opportunity. Thank you.
That was a wonderful session by Professor Sendil Kumar and about prescription, exercise prescription. And he has detailed everything about the prescription, whom to prescribe and what to prescribe, how frequently you have to do everything. I would like to add one more thing. If you do exercise for 1 hour daily, it will take care of your body for another 23 hours. If you don't exercise, you have to take care of your body with medications. Thank you.
Thank you once again, sir, for an absolutely brilliant presentation. Integrating the digital age with the exercise prescription is the future, and you mapped it out beautifully for us, sir.
I now request our esteemed chairpersons, Dr. Prem Kumar sir and Dr. Trivenkatam sir, to kindly come forward and present the memento to our guest speaker.
Thank you, sirs. Now I request Professor Dr. Susila Thangam ma'am and Associate Professor Dr. Veerakumar sir to felicitate these chairpersons. Thank you, ma'am. Thank you, sir. Now we'll have a break for lunch and all are instructed to be here by 2 o'clock. And delegates are requested to go to the physiology department for lunch. We invite the delegates